political part, we didn't have anything the other day.
Okay.
Then I'll move on to why can't move on? Economic. Yeah. So these two are the ones that I added in. But there's one point that all of you mentioned that I should find out from doctors, any NGO working either mental health or homelessness, who receive funding before and how are they using it. So this part I have not met any doctors since we spoke. So I didn't ask any doctor, and the number of doctors that I am in contact with is a bit limited.
Oh, what's the reason for the limitation?
Because, since I joined, right, the number of times that I went out with the reps or the sales manager, not a lot. So I've only met like UMMCs, those head, like it's very senior, like the head of department, and then senior prof, and those who are my speakers lah.
And how many people is that?
In UMMC, I think maybe around so far speakers lah, prof I got around 5 or 6. But then like the master students, I've roughly met them, but I'm not close to them lah.
Okay.
Like we are not in constant contact.
Who else besides UMMC?
MOH, I've met Northern's HOD.
All right. How many people is that?
I have Kedah, Penang, Police, HBUK. Yeah, around 4 to 5 from Northern. And then from Southern Johor, I've only met one of the HOD.
Okay.
And one private specialist.
Right.
And then in Malacca, I've met let me see. I've met a few, but in Malacca Hospital, maybe 3 to 4. And then, but they are not my speakers lah yet. Only 2 of them were my speakers before. And then, but we all contact through email lah. So, not very close yet.
So, Fiona, you have about 10 to 15 people from your account. And don't let that stop you, whether they are close to you or not. And just send an email and or make a phone call. And that can be done very, very fast. If you send an email, it doesn't take, more than a day for you to get some response.
But if let's say they don't respond, it's okay lah. They are okay, all right?
No, the question that you need to ask yourself is, do you need this information or do you not need this information?
Yeah, I need.
So if they don't respond, then you got to pick up the phone.
Okay.
Yeah, so you don't have a choice, because otherwise then we are giving excuses why we don't have information. So that's not going to work for marketing people. So we need to use whatever tools we have to get the information. Because when you put it up here, the question you must ask yourself is, why are you putting this up here? What's the reason? What are you trying to say? 15 million allocated to NGOs to help social issues such as mental health. So what? What is that? What is the impact of that on mental health?
Okay, I mean,
is there an impact or no impact? No, that's what you need to find out.
Yeah. Okay.
So rather than guessing, this is why you reach out to your doctors, and whether they are speakers or not is immaterial. Doesn't matter whether they are speakers. That has got no bearing at all, because a specialist is a specialist. So all we want to know is whether they got any information.
All right.
So that's the reason why you're reaching out to them.
Okay.
And coming to the first point, you have mentioned the allocation for psychiatry and mental health reduced by 31. So what do you think for 2022? Will the budget be reduced further, or will it be the same, or what?
Based on the news that I've read, like recent newspapers, right, they have been mentioning about increased suicide, depression. I would assume they will try to maintain. It won't increase because they have used up quite a bit of money for helps, giving money out for to people, even M40 groups. So I think next year we wouldn't have like enough money to increase the mental health budget. The best they can do is maintain.
Yeah. So what you should do when the first sentence, the allocation for psychiatry and mental health, I would suggest you should put another point ahead of that, which is the first point. The first point should be that because of the COVID situation in Malaysia, the government has been funding a lot of people who are jobless, who have a reduced salary, all those things. And the government is borrowing money to do this. Okay. So therefore, the second point, you can continue the second point. So the next sentence in the second point, after you put there, reduced budget, therefore we anticipate that for the budget 2022, the government will just maintain that, the budget allocation for mental health. That's all.
Okay.
Then you're good to go. Okay. Now, the third point, Fiona, after you have, spoken, you don't have to speak to all 10, Fiona. Just 5 people is enough. 5 specialists is good enough. Whether they are from UMMC or MOH or even the private doctor, that's good enough. So you just call up 5 people and ask, Doc, do you know, you can just tell them, look, Doc, I read in the paper that, government gave 15 million to NGOs for, mental health. Do you know of any NGOs that are using this money, and how are they using for mental health issues? So just ask their opinion. That's it. And then you can report there. Okay, based on my very basic market research with some of the specialists, this is what they have mentioned.
Right.
That either nobody knows them using this, and even if they use this, whether there is any impact on mental health or not. So that's what you just need to know.
Okay.
Yeah.
They might not know whether there is allocation as well, right?
Yeah, they may not even know. So you just contact 5 fellows, and then if none of them say no, I've never heard of this before, I don't know what is going on, just put that there. No, none of the specialists, the 5 specialists I reached out to is aware of this program.
Right.
So therefore you can say that probably this money has got zero impact, on mental health.
Okay.
You're stating very clearly that you have done your job, because if anybody asks you, is this working? At least you can tell, I reached out to 5, nobody knows, even the specialist doesn't know. Right. Or the specialist knows, and let them say what they think the impact of this is. It's better for you to hear from the specialist than we making up our own story, yeah?
All right.
Because then somebody will challenge you and say, have you verified this? And then it can be embarrassing if we don't verify it, when we can, Yeah? All right. So good. So that's fine. That's all you need to put on economics. Yep. Then also one more thing, Fiona. One more point that you can put up is the point about a lot of Malaysians are losing their job because of so many lockdowns during this COVID period, especially this year. Either losing jobs or pay cuts and stuff like that. Therefore, what this means for mental health is that the majority of mental health patients will definitely go to government hospitals for mental health care. They won't go to private hospitals because they got no money.
The new ones, or doesn't matter like whether it's a new patient or existing patient.
Even a patient probably who is going to the private specialist maybe he has lost his job or her job, and therefore they're going to go to government hospital. Because when you don't have money, you're not going to, you're not going to go to the private. Yeah. So just put that there, and you're good. At least then you are kind of protecting yourself, Fiona. Because if let's say regional office comes back and tell you all in September or October next year, your budget for Lexapro must increase by 10%. So with all this information you have here, this is how you argue with your, you put forward your rationale why the budget cannot increase. At the most, you can only maintain, not increase.
Right.
Yeah. So that's how you kind of, it's a numbers game, Fiona.
Okay.
The marketing plan is always based on numbers, not on, guesswork, my opinion, or, your opinion, or stuff like that. So everything is based on numbers.
Would if I put here, right, like patients might choose to go to government, would regional office say like, then it means your government sales will increase lah? Would they like kind of?
But look at what you have put on top. Your point number 2 is what? Your point number 2 is the budget is maintained, right? Yeah. So the budget is maintained, and that's what we think. At the end of the day, only in October or November, the government will state their budget. Only then will we know.
Okay.
But we all know that the Malaysian government is definitely is having a lot of difficulty coming out with money. Because they got to pay for the vaccination, for the COVID. They got to pay. They got no more money. Companies are closing down. They cannot get tax. SST has. They can't collect SST because people got no money to buy anything. So no money coming in. That means your budget is going to be maintained or slashed.
Yeah.
So that's what I mean by covering yourself.
Okay.
So that's why this is normally what we do to protect ourselves, Fiona. We are not trying to cheat, our regional office. It's just that we are not being over optimistic.
Oh, okay.
We are trying to be realistic. Okay. So that's what we are doing. Yeah. So it's not that we are cheating them or anything, but this is the reality in Malaysia. So so every time you do a marketing plan, just make sure that you have all this information. Just tweak it. So next year when you do your marketing plan for 2023, just do the same thing. Just come here and just correct it a little bit. Touch up here and there, and then you're good.
Okay.
This thing is not going to change so much. Whatever you created here is not going to change so much from one year to the next year.
Okay, understand.
Yeah. Okay. All right. Okay.
Okay. Then.
And let's face it, Fiona, Malaysia is not like China or US or India and all that, which are big countries, where the economy can grow. Malaysia, the economy is going to suffer so much. I don't know whether you are following the new news, but if you look at the US and you look at China, you find that they have come out of, although they have not completely come out of COVID, but their economy is growing. Malaysia's economy is declining.
Yeah.
So, and Singapore's economy is also growing. Yeah. Vietnam is growing. Indonesia is also growing. So Malaysia is not a country which is a strong economy. Okay. So it will take us, I don't know, some people say 2 or 3 years before the country starts growing again.
Oh.
Yeah. So things are not rosy for Malaysia, So I don't know what your regional people are hearing or reading, but hopefully they don't see a rosy picture.
Okay.
Because that's wrong, because they are close to China. They are in Hong Kong. And they may be thinking, okay, China is growing, so therefore I expect Malaysia to grow. So no, that's not what's happening.
Yeah.
Yeah. So that's the important point. So that's what I want you to learn from, preparing this marketing plan, especially the economics. So the economics part is where we are trying to tell whoever is reading this, or especially yourself, because when you fill up the regional template, you have to take information from here and put inside there.
Okay.
Yeah. So that's why you are preparing this. So you have the background.
Okay.
Okay. All right. So let's move on. I think that's good enough for economy. I don't have to put some. Okay.
Okay, so for social, I've already added in whatever given. So then after that, I found out, right, like this, the first point, remember the less top mental health. Yeah. It's actually a 2019 campaign.
Right.
Yeah.
Is it still ongoing or cancelled?
Yeah, so I try asking, nobody knows about it.
Nobody means who? Who did you ask?
I asked because so happened I was talking to one of the doctor yesterday lah. So only one. So I just like, hey, have you heard about Let's Talk Healthy Minds? And then it's like, what's that?
Is this a government doctor or a private specialist?
Yeah, but unfortunately he is a private.
Okay.
Yeah, so I think maybe private wouldn't know such thing
because
private can.
No, but this MOH campaign, is it only for government hospital or is it nationwide?
I think it's nationwide. It's nationwide.
So if it is nationwide, and this specialist is from where? Where is he based? In which hospital?
He is from Pantai.
Okay, so a Pantai specialist is not aware of this, and Pantai doctors, of course, they are not in the rural areas. So they are in KL or in Klang Valley. So if they don't know about this, then it means that the government's campaign is probably not a successful campaign. So if you check with that 5, I told you to check the 5 doctors, right? Yeah. If you call those 5 fellas and you ask 5 of them, and they all don't know, if even the UMMC doctor doesn't know about this, then you can bet that this is probably a campaign that was not very strong.
Not successful lah.
Yeah, not successful at all. Which is what we all know when the government does anything, it is never, it is never a good program.
Yeah, it doesn't it doesn't reach out to a lot of people.
Yeah. So what you can say, Fiona, once you have got enough information, you can continue with that point.
Yeah.
You can say, based on my discussions with the specialists, some of the specialists in private and government, none of them have heard of this, and therefore we can say that this campaign was probably not successful at all and didn't reach, probably has no impact.
Okay.
Yeah. So and you can also say that you have Googled it and nobody is talking about it.
Yeah, really, nobody.
Yeah. So that's one way that you are informing regional also. Yeah, the Malaysian government does all these things, but no impact. Waste of money. Whatever they spend their money on.
Actually, I want to ask, right? Like the social part, would it mean something to the regional office? Like the information I have right here, right? Would it mean when they see? Would it like what does the thing that they will get from the social part?
Okay. Now your template, by the way, for regional, Fiona, when I had a look at it, if I remember correctly, there is no place there for you to input qualitative information like this here.
Okay.
Is that correct?
Yeah.
Correct. You only input numbers.
Yeah.
Right?
Correct.
Yeah. So your numbers are coming from information that you put here. So let's say, for example, after you put your numbers, let's say you put your, let's say regional asks you, okay, where do you think the growth, how much is the mental health market in Malaysia going to grow? I don't know, maybe you're going to put 0.5% or 1% or something like that, And then the regional come back and say, how come so low?
Yeah.
I heard in the news when I Google, although I'm sitting in Hong Kong, when I Google, I see that mental health cases going up in Malaysia. How can you say, the market is only growing by, 1%? And then you can say, well, IMS report says this, that is growing at, 1%. The government's campaigns are not working. Number 3, Malaysians have lost their jobs. So they are not going to, so the private sector is not going to grow much. They're all going to go and flood the government hospitals. But the government has got no money. So what are they going to do? So that is why, so you can say that's the reason why I have put there as 1% growth. So that's how you put forward your argument.
Okay.
Now, this marketing plan we are preparing us, Fiona, is only for you, because you are not going to send this to regional, correct? I don't think they want this. They just want their template only. So this is for you, for the sales managers, and for Kinsang as reference material for you all.
Okay.
Yeah. So when you do this, then you get the full picture. Then you know how to rationalize your budgets, your targets, your budgets, your plans, everything.
Okay.
So when somebody question you, hey, why are you putting so much money in let's say MOE hospitals rather than MOH, and then you can say, look, MOE is growing this much faster than MOH, for example. I don't even know. I'm just guessing. So that's how you argue and say, based on the numbers, that's where I should put our money, right? I mean, we are business people, right? We don't put money in a dying sector. We put it in a growing sector. Yeah. Okay. So that's the reason why we are preparing this template, Fiona, so that you get the background of the information you're going to put in the regional template.
Okay, understand.
So you don't have to guess anymore. When you do the regional template, you don't have to guess anymore, because you know exactly what is happening in the country. That's why we are looking at this situation analysis. So then things become very, very clear. Then when somebody challenges you with some information, you can say, well, look, I have, according to the marketing plan I have done, this is what we are seeing in Malaysia. Then you can present to them and let them think about it and say, oh, okay, yeah, I agree or I disagree. Maybe they will give you some other ideas as well.
Okay.
Yeah.
Yeah.
So that's the purpose of this marketing plan, Fiona. It's so that we remove all the guessing that we usually will do when we don't have a marketing plan.
Okay.
All right. Okay. Great. So let's move on. Next point. Okay, run by sector. Okay. No, I don't know what impact this one has. Maybe reduce congestion. Okay, fine. Reduce congestion so they can probably treat more patients. Okay, fine. Remove the stigma. Okay, good. Next point. Awareness groups. I think we went through that, right? Green ribbon group. Oh yeah. What about this? What actually are they doing?
Actually, they are actually very active on social media.
Okay.
I mean on Instagram, and they are also actually they are also telling all those like famous rich people about this group, and given them like the green pin ribbon for them to wear, even politicians when they go out, so that when people say like, oh, what is this green thing? So it's more of raising awareness right now, because they can't do a lot of things. So raising awareness, or they also sell like t-shirts, merchandises to raise money. But then I don't know the money goes to where lah, because it wasn't stated. So right now they also have like when they first started, which is this year, they had like 1 or 2 sessions of talks lah.
All right.
Yeah. So
talks with whom?
Psychiatrists. Yeah.
And what was that talk about?
It's actually regarding, if not mistaken, it's bipolar, and then they did mention about depression as well. So it's really about just awareness, like why people are not seeking treatment, what are the signs and symptoms. So
this is for the doctors, for the specialists. No, mental health specialists.
It's posted on Instagram. Anyone can watch the video.
Okay, but it's the talks that they held. Is it to educate psychiatrists or the public? Okay.
Yeah, so it's very basic. It's very layman and very basic. So
right.
So it's very easy to understand.
How many people on their Facebook group or their Instagram account?
I don't remember. Not like the normal influencer, like so many, right? No, they are not, because they just started.
Oh, just started. Okay.
So you will see like people like the NASA family, like the sisters, they will share about the page, and then like
Right,
a few
right.
famous people lah, yeah.
Okay, okay. So the
But the
NASA family is involved. Okay.
the NASA, even politicians like who are some of the politicians they sometimes will wear the pink
Really?
the
Yeah,
green
I never
ribbon.
seen anyone wear the green ribbon. Actually.
Yeah, God. But
Are you all wearing it, Fiona?
so when they have like these interviews, right? Sometimes they
Yeah.
will wear it lah.
Okay. Okay. Right.
Yeah,
Okay. That's interesting, huh?
yeah,
Actually, yeah, that's a good point, Fiona. Green ribbon. Okay, let me just take this down.
yeah.
Green ribbon. But what is their impact? What do you think their impact is?
I think it's just to. I think it's just they are just starting to want to reach out to, especially the Malay communities.
Okay.
Uh,
Now, Fiona, when you go to their website, either their website or their Facebook page, or even their Instagram, are you following that, by the way?
yeah,
You are? Okay.
yeah.
Now, what are the questions that people ask on their Facebook group or on their website if they have any comments enabled? What do people ask?
Yeah, that's the thing, nobody comment anything.
No, that's typical Malaysian, nobody asks anything, nobody comment anything. So, yeah, this is the problem, in Malaysia. People don't participate at all. So we can't even know how successful this is.
Yeah,
Yeah. I
really.
thought it would be great if you find people asking like, what drug should I take? How do I manage? How do I diagnose? How do I know? How do I care for, whatever,
Yeah.
a psychiatric patient or an Alzheimer's patient or whatever. But yeah, that's a pity, But green ribbon is for any mental health, or is it psychiatry and that means depression and schizophrenia and bipolar and all that?
Let me check. Green ribbon, I think, is for depression.
Depression. So that means Alzheimer's is not included there.
No, let me see.
I don't think so.
Just
Probably not.
Wow. Green ribbon. I think it's all mental health. Yes.
Yeah. But technically is Alzheimer's considered mental health, or is it?
No.
It's not. Okay. Right. Yeah. Okay. That's what I thought also. So what that means, Fiona, since you got two products which are in mental health and one is Alzheimer's, when you create this social slide for the Alzheimer's for Ibiza, remove everything that is related to mental health. Take it away,
Okay.
Because I don't think the Alzheimer's versus people are going to Mentari.
Yeah, no.
Yeah, and the green ribbon group is irrelevant to them.
Yeah.
Maybe you want to talk about, an Alzheimer's association or foundation or whatever it is. Okay. So just make sure that it is relevant for that category, the disease category.
Okay.
Yeah. So whatever you're mentioning here, mental health, just keep it for Lexapro, and what's the other product you're handling?
Brintellix.
Brintellix, yeah. So Lexapro and Brintellix, this is fine. But for Ibiza, just make changes here. Just keep it only for Alzheimer's related. So you can talk about dementia and all that kind of stuff. Yeah. Okay. Yeah. Great. Okay. 15 million, but not directly. Hey, this is similar to the one you put in
economics. Yeah.
So then you can just you want to put it where, here or the other side? Where do you want to put it? Yeah, I think you can leave this here.
Here, then leave it.
Yeah, I think you can leave it here, because what you're saying here is that what you're trying to say here is not directly impacting mental health. Yeah. Okay. So take away from economics and just leave it here. Or you can keep it on both sides, It's okay. Just leave it, leave it. So it's okay. As long as you know, that it is in both places. Yeah. But both are telling a different story. Okay. One is saying that the government running out of money. The other one is saying is over here, no impact. or we don't know what the impact is. Right? Okay. Hospital restrictions. Okay. Yeah. So patients can't follow up. Hospitals. Okay. Fine. Okay.
Yeah. So you have longer follow-ups. Right now, even more hospitals converted to COVID hospital.
The other thing, I think, Fiona, that we may have discussed this during our very first session, which is that did the doctors tell you that patients are scared to come to the hospital because of they are scared that they will pick up COVID when they come to hospitals?
It was during the first, very first lockdown
Last year.
Then
Okay.
after that, like after June, July, then doctors were mentioning that you can see patients coming back. And then then we had another like minor lockdown kind of thing, right? It doesn't impact anymore.
Okay.
Patients
Good.
are okay to go back. Yeah, it's
Fine.
just that appointment they limit the number of patients to go into the hospital, and then the appointment is very long.
So now everybody works on appointments, huh?
Yeah, appointments.
Okay.
And MOH, if they can do teleconsultation for MOH, they will do it.
Oh, so MOH does teleconsultation.
Yeah, MOE no.
All right. So what about? Okay. So we'll come to that later. Okay, fine. Yeah. MOE no teleconsultation.
No, because of the PD, I think they were afraid of the PDPA, don't know what So then I don't know why they are not like similar to MOH because MOH they did it since last year.
All right. Okay, good. So put that here as well. No, don't put that here. Put that under the technology part. That MOH is doing it, but not MOE for whatever reason that you mentioned. Yeah. Okay. So let's move on from here. I think this is pretty good.
Okay. Then the technology.
Okay. So online consultations. Yeah. So MOH. Okay. Teleconsultation, but not MOE. State the reasons why. For the MOE, why they don't do.
Okay.
And then, okay, online consultations, doctor on call, private hospitals. Were you able to check with any of the private doctors whether they're actually using doctor on call or some other tool to do teleconsultations? Is it working or
not? So I remember speaking to one of the Penang doctors. So she is actually not on doctor on call
Yeah.
So what she does is that like the normal online consultation, like she will just contact the patient and then say, "Oh, how are you?" and stuff like that. But then the patient is not newly diagnosed patient. So like for doctor on call, right? I think they will also see new patients, or so I haven't spoken to anyone who is in doctor on call. So I don't really understand whether you can diagnose patient through doctor on call.
All right. So before that, let's just stick with this Penang psychiatrist. So when she calls the patient, is this a private specialist?
Private.
Okay. So how does she earn money? Do they pay her after she makes the call, or does she earn any money from this consultation, or nothing actually?
I never asked about the money part.
Yeah, so that's what I'm trying to get at,
Okay.
Because my next question, Fiona, if you go to doctor on call, and I did this with Siwei on Tuesday, we went to doctor on call, and we checked through the psychiatrist on doctor on call. We only found one doctor who you can make a point. All the psychiatrists on doctor on call, the doctor on call is only for appointment setting. You cannot do any teleconsultations over the phone or Skype or whatever they use. They don't allow that. They don't want that. So I don't know why. Maybe it's PDPA or whatever reason, but nobody's doing that, Fiona. So doctor on call is not a teleconsult. Or Malaysian doctors are probably not comfortable yet doing teleconsultation on doctor on call.
So how?
So why don't we do this? Why don't we go straight to doctor on call now?
Yeah.
Just open up doctor on call.
Yeah. Hold on.
Yeah.
On call. Is it the first one? Right. Doctor on call.
Yeah, correct. That's the one.
Why choose us?
Is this the one? This is Singapore one. You need to go to the Malaysian one.
Oh, here. Talk to a consult specialist.
If you can you see at the bottom the orange long bar at the bottom?
Consult a specialist.
Yeah.
Stop here. Maybe Dr. Get.
Yeah. So if you so these are these the psychiatrists? Okay. Do they allow? See, everything is inpatient. Even this Dr. Ang, you can only do in person. Which means no phone consultation.
But then I remember hearing, the advertisement, right? Doctor on call means like you can call the doctor, no?
Yeah. So which means which means that psychiatrists are probably not comfortable using this. That's what it means. Maybe cardiologists they don't mind, or maybe general physicians or chest physicians they don't mind. But psychiatrists are probably, for some, you won't find, Fiona, when you go through this, you are not going to find, okay, so this is one guy. No, he's a urologist somehow. So, so urologist, maybe he gets the patients to, because his video, he gets them to pull down your pants and he checks.
So it's so different. Like, let's say.
Yeah, exactly. See, neurosurgeon, okay, I don't know how he's going to do video. He can't check the brain anyway. Maybe he'll check the scar and all that, maybe after the surgery, could be, so you see, most of them, when you just spend about 20 minutes or 15 minutes, I'm telling you, you won't find enough psychiatrists doing teleconsultation in Malaysia. Not yet.
Yeah. Also. Yeah, all has to be in person. Then what is the point of doctor on call?
Yeah.
Oh. Doctor. Oh, so in person. Okay. So doctor on call is actually irrelevant.
Yeah, I would say, but leave it there. It's okay. Leave it there, because when you have it here on the template, Fiona, as the years go by, every time you do a marketing plan, at least it will remind you, hey, let me check and see whether now got more psychiatrists who are using doctor on call.
Okay.
Okay, but what you will see is that at least today the psychiatrists who are on doctor on call allow appointment setting. So that's a good first step for Malaysia.
Allow appointment setting.
Yeah. So anyone can go into doctor on call. If I want to see the Sunway specialist psychiatrist, I can create my appointment using doctor on call.
Yeah, but
instead of picking up the phone and calling to set the appointment.
But I think, like, let's say if you go into Sunway's website, right, and then you find the doctor, you can also do online appointment for SDMC lah. I know SDMC can.
All right. Okay. Okay.
Like just book appointment, but you are not talking to the doctor yet lah. You have to go to the hospital.
Yeah, just making an appointment. Exactly.
Yeah.
Yeah. So, but leave it here. You just leave everything here as it is. Okay. So you can say the conclusion is at the moment, Malaysian doctors and Malaysian psychiatric patients are not using these, tools, not using them effectively. or efficiently yet.
Okay.
All right. Okay. Okay. Good. Let's move on then. So
Okay.
nothing on
Next,
technology. Yeah. So let's
legal.
legal
Nothing.
nothing. All right. Okay.
Environmental, I put
No, don't put it here. Environmental also nothing. I don't think you have anything environmental. So because you have already mentioned the loss of income
in social.
in not social, you mentioned it in economics actually.
Oh. Okay. So environmental is like what type of issues
Okay, now
usually?
certain businesses, not pharmaceuticals, certain businesses, they have got environmental issues. Like for example, if you are, let's say for example, if the marketing plan is being done by your head office in Denmark, and they will definitely have to look at environmental issues because they are producing tablets and all that, right? And during the production phase of the tablets, they have to look at how are we, how are we managing our sewage water? How are we managing our, the emissions into the environment, all that kind of stuff. So in your case, you got nothing here because you are just a marketing company.
Oh, okay.
So
Unless
no
I'm
impact for you.
producing it.
Unless you're producing. Maybe one day there's something may come up, but just leave it here because this is a template just for us to think about it as the years go by. Is there something that we are impacting the environment? One day it may come up,
Is it?
Fiona. Yeah, one day it may come up. Like for example, I don't know if you're familiar with this. One of the big problems that has been detected in Canada and US is that a lot of people throw their expired tablets, either psychiatric medicine tablets or birth control tablets, into their sink, and then it goes into the sewage water. It is cleaned, and then it goes out to the lakes, the Great Lakes, that borders US and Canada. And what people have found, the environmentalists have found, Fiona, is that when they test the water, they find that there are psychiatric molecules inside there, birth control molecules, and therefore it's affecting the fish. So the fish that people eat that is caught from that lakes, that drug is being passed on to the patient, to the people, the consumers.
Okay.
So in the US and Canada now, that's a big issue. So now they are working with with pharma companies on how to prevent. What can the pharma companies do to educate people to not do this? You know what I mean? So in Malaysia, I don't know what Malaysians do when their products expire. They probably throw into the dustbin. Malaysians throw into the dustbin. In the US and in Canada, in their sinks, they put their let's say after you eat your food, we always throw in the dustbin.
Yeah.
Americans, Canadians, Australians, and British people, they don't throw wet waste into the dustbin. They put it into their sink, and in their sink they got something that will crush all this thing.
Okay.
So let's say, for example, you have eaten chicken, the bones, right? The chicken bones, or maybe you have eaten pork ribs, yeah. So the pork rib, it's cartilage, right? Some of the cartilage, okay. So you put all that into your sink, and then there is a spinner inside there that will crush all this, and that will go down to your sewage. So that's what they do. So a lot of Americans and Canadians, they throw their expired tablets all inside there to crush, rather than inside their dustbin.
Oh.
So Malaysians, or rather Asians, all Asians just throw inside a dustbin, except maybe the Japanese, because the Japanese may have this thing in their kitchen as well, and maybe the Koreans, But the rest of Asia, everything inside a dustbin or throw inside the river. So yeah, throwing inside a river will have the same problem, Yeah, but for Malaysia at this stage, just leave this blank. But one day it may come up, Fiona. So just keep it there. Just each time you do the marketing plan, just think about it for 5 minutes. Is there anything that I can put in? Nothing. Just move on to the next thing. Yeah.
Okay.
All right. Great.
All right. So next will be the so I have clarified with Doreen. So the error was that I don't know whether you are familiar with sales cycle. So the different thing that I did was that I didn't add in PharmaServe because I overlooked that PharmaServe sale is actually out of the monthly sale.
Okay.
Yeah, so then we identified I did add in PharmaServe sales into.
So so we are looking. So now you got the full data here, right?
Yes, the correct.
And you have 12 months rolling of Lexa Pro.
Let me show you if you want to see.
So this is Jan, December, Feb to Jan. Okay, good. June to, okay, so you got.
So if from here, right, you can match here. This thing, I can say that it's impacted by our last year's MCO, right? Because the sales suddenly dropped. Then, right, this thing is the drop of our MCO, right?
Yeah, last year it started in March, right?
Yeah.
Mid-March or end March. So therefore you see the impact in April. And then it picks up in May. Oh, pretty good. So after that first MCO, you've been growing always, huh? Very good.
I think here very high because before the MCO, right, people stock up because they don't know like how and what will happen, right? So then they stock up a little bit here, and then April not very much sales, and then after that I think kind of get used to the MCO, like how it works, so then slowly pick it back up.
And Lexa Pro, is it still in tender?
No, our Lexa
no more.
Is actually
so this is entirely private sales, huh?
Yes.
Is that correct? Wow,
correct.
Very good.
We have a little bit lah, MOE, UMMC. The rest MOH all goyak already.
All right, very good. So that means your private sector is still doing very well. This is nice. I like this. And how many years old is Lexa Pro?
Lexa Pro, I think, if not mistaken, is around 14, quite old.
14 years in Malaysia or 14
Malaysia.
14 years in Malaysia. Very good. So you got a 14-year-old product which is growing at 4.4% last year, right? Okay. Now, a couple of things that I want you to do, Fiona. Right. Before we look at the Lexa Pro 12 months rolling, the first thing you must do is show your sales versus your target for 5 years. Just do maximum 5 years. So you can do a bar chart to show what your sales is like. Can you?
Sales versus target.
Yeah, sales versus target.
In 5 years.
5 years. That's the first thing. Second thing, sales growth for 5 years.
Yes.
Now, when did Lexa Pro lose the tender?
I don't remember.
Can you find out?
Can find out, yeah.
Fiona? Because what I'm trying to say here is because if you lost the tender more than 5 years ago,
definitely.
Then it doesn't. More than 5 years ago. Okay, so that means the data that I'm asking you to show is only private sales. So that's fine, because otherwise you will have, very high government sales included. Then suddenly 1 year it drops. So that is not going to. It's not a big issue as long as you qualify what happened. Why the sales collapse. That's okay. But fine. So I want you to do that, Fiona. Because that is important, because that is basically how we see, the movement of products, sales versus target for 5 years, and the growth essential. And then comes the other three things like the 12 months rolling, 6 months rolling, and 3 months rolling.
Yeah. So
Okay.
this is
So when you have the data, what does it look like, Fiona? The sales versus target for 5 years?
Let me find 5 years development. So this is the one that I did 六七八九十 5 years, yeah. So the dark blue one,
Yeah.
is Lexapro.
Okay.
Yeah, so from 2016 to 2020, it looks like it's increasing, but in 2020 it drops slightly.
Okay, very good. Hang on. So that means it didn't grow. Is this which product is this one?
This is Lexapro, but the tail one would be Brintellix.
But just now you showed that 2020 versus 2019 was a growth of 4%. Is this including PharmaSelf?
Yeah, that's why.
Okay, so you got to add it in. Got to add it in, then okay, so good. So at least you have that graph. Now, what I would suggest you do, Fiona, that graph just now you showed me, that Lexapro and the Brintellix graph. When you are showing the marketing plan for the brand plan for Brintellix, just show the Brintellix graph.
Yep.
When it is for the Lexapro, just show for the Lexapro graph. Yeah? So you don't need to combine both. Okay. So pretty good. That's nice. Really nice.
So for this 6 months rolling, right? I don't know whether you can see.
Yeah. Let's have a look at the 6 months.
Yeah. I don't really understand. Like, I don't really know how to interpret the 6 months and the 3 months rolling.
Okay. So yeah. Okay. So okay. So where is your so your 12 months in some other place,
12 months
so
here.
So what you are seeing basically, Fiona, the reason why we do the 6 month and the 3 month is to see whether 12 months is very long, right? And of course 5 years is very, very long. So that's why we don't even bother doing it. For 5 years, we only look at sales versus target and the growth. That's good enough. But when we do 12 months, we want to see, okay, what has happened? How has the product been performing over 12 months, moving or rolling 12 months? We want to see whether, there are, whether it is actually growing. Because when you look 2020 versus 2019, it will show, very nice, 4%. Yeah. But when you look at rolling, then you can see more details like, okay, how has the 12 months, Jan to, December that year, then February to Jan, how is it moving? Is it always growing, or are there certain periods when it declines?
Okay.
And then we look at it and see, okay, what is the reason for it to decline? So when you, instead of 12 months, when you shorten it to 6 months, we are looking at half yearly. So we are trying to see what has happened February to July last year. Did something happen? Yes. What happened, Fiona? February, July last year?
March, we had MCO.
Yeah, you had the MCO, right? So therefore it dropped, right? And then we move forward. Okay, March to April, what is it like? Okay, it slightly increased. Yeah. Sorry, March to August, slightly increased because, as you say, people are getting used to the MCO and all that. And therefore, they are learning how to set appointments and work around appointments and stuff like that. Correct? And then you see there's a slight drop in April to September. Not sure what happened actually. Maybe what could have happened. Maybe there was another lockdown. Who knows? I can't remember. So what happened that time?
Is it in June? No, it was until June, March until June.
Yeah, so maybe there was an impact from there. And then after that, what you find is consistently after the April to September period, consistently you have been above that line,
Mm-hmm. Mm-hmm.
which means that you are performing better and better every 6 months.
Mm-hmm.
Now, when you look at the 3 month, that will show you what is the most recent trends. We are looking at trends only, Fiona. That's what the rolling analysis always does. So when you look at this, okay, when you look at 3 months, what you find is that, okay, Jan to March last year, there was a sharp drop because of the MCO. And then Feb to April, also a big drop, right? March to May, kind of stabilizing. Can you see that?
Okay. Yeah.
The worst period was April to June.
Yeah.
Lowest sales for 3 months. After that, you start picking up.
Mm.
Yeah. So what that means is that based on this, you can see that every time there is some kind of a lockdown, your sales is going down.
Mm.
If you look at March to May this year, you find that there's a sharp drop, but still better than last year, okay? Not worse than last year. Okay, so that's the idea you're trying to see. You're trying to see trends. Are things improving or are they getting worse? Based on this graph, I will say things are improving, Fiona. Of course, not like Jan to March last year. We haven't reached that stage yet, but you will reach that stage based on your April to June sales. I can see that you are probably coming up to that level maybe in 2 quarters from now. You probably will come back to Jan, March last year.
Okay. By end of the year lah.
Yeah, I think by probably end of this year, you should be back to square one,
Okay.
Yeah, so that's what we're trying to see. We're just trying to see trends and seeing how the movement from this, hey, what's the reason it went up? Like, for example, Jan to March 21, why did it go up? Big rise, this year, Jan to March this year. Huge increase. What happened in that 3 month period?
I remember.
Were people stocking up?
Yeah, I think it's, it could be stocking up because this year, beginning of the year, we started with a lockdown as well. Remember? Yeah. It could be because of that. Price increase, I don't think so. No.
Right. Okay. Okay.
Yeah.
All right. Okay. So that's basically what this rolling analysis is all about.
Okay.
All right. So now can you go back to that slide that you were showing me earlier? So certain corrections that you need to make here, Fiona. First of all, just show your graphs. So the sales versus target for 5 years, the sales growth for 5 years. Then you put up this 12 months rolling, your 6 months rolling, and your 3 months rolling. Just put all those up.
I can put all three up lah.
You can put all three up. You can put them all together on one slide, all the three, or you want to put separate slide. Doesn't matter, because this is only for you. You're not sending it to head office, so that's okay. This is for your reference. But what I would ask you to do, Fiona, all the comments that you have below this slide, take all of that and put it under the situation analysis under brand.
Situation analysis under brand.
Because you got a slide for brand, so you got to make comments about the sales movement.
Is it? Brand. So I create a new page, right?
You should have a brand slide, right? In my template, I gave you all a brand slide as well.
Is it this one?
No, next one. Where is your brand slide? You got customer patient, brand category. Yeah. So it is here that you make all the comments that you have picked up from the other side. Only put relevant comments. Only put relevant comments. So if we go back to that first slide, the relevant comments that you must make is, first comment that you must make is make a comment about your sales versus target for 5 years. From what you showed me, what can you say about that, Fiona, over the last 5 years?
Steadily growing.
Yeah, steadily growing. Yeah, so that's good. Yeah, just have to say that, steadily growing. So yeah, you're growing steadily. Good. Sales growth, what does it show? Okay, sales growth shows steadily going. Sales versus target. Have you been achieving target every year in the last
For
5
example,
years?
yes, I think, but I
Okay,
have to.
good.
I don't have the 5 year sales versus target. Wait, let me
Okay,
see.
try to find it and
Mm,
make a comment about that as well.
mm,
Yeah. So then you can say, okay, sales versus target. We have been achieving sales targets every year for last 5 years, and we are growing, every year. You can even say, that last year's growth, 2020 over 2019, 4.4%. 2020 over 2016, how many percent? Because that probably will be a different figure.
okay.
So the 5-year growth will be different from 2020 over 2019. So you're basically trying to say that Lexapro, although not in the government hospitals, never mind, we are still growing. Old product, never mind, we are still growing. Brintalix is a new product. Lexapro is an old product, but we are still growing. Okay, AOM is the new product. Which we are using, or is it Resulti? One of these two. Sorry, Resulti. Resulti is to be used as adjunct.
Yeah.
Yeah, but we are still growing. Brintalix is still growing. Lexapro is still growing. So, that's good. So that's all we want to say. That it is growing.
Okay.
You see, a lot of people, Fiona, since you come from Astra, AstraZeneca, you know that in these big companies, AstraZeneca, Pfizer, Sanofi, and all these people, once a product the patent has expired, they got no time to promote this product. They give it to Zulik or Dietlam or somebody else to handle it for them. Okay. And then their growth rate, when they pass it on to all this, Zulik and all, is probably about 1%, 2%, whatever it is like. That's all. And they got zero marketing. They don't do any more marketing.
Yeah.
But what you are trying to say here is, although patent expired, we are still growing and we still got plans for it. Maybe, I'm not sure whether you got any plans for it, but at least you are trying to justify why you are still having the plans. So that's why we are doing all this kind of analysis, showing all this, looking at these trends, so that we can decide when we set the objectives, what should 2022's objective be? What kind of number should we use? What kind of percentage growth should we set for next year? That's why we're doing all this. That's all. Right? So all these comments here, Fiona, at the bottom here, bottom of the slide, you don't have to comment on everything.
Okay.
The very important comment you must make is the sales versus target, the 5 years, sales growth. Sales growth for 5 years and sales growth for last year, which is what you have put right at the bottom. And then the 12 months, 6 months, let me see. 12 months and 6 months. Ooh. Okay. Okay, so you can basically say, Fiona, that the 12 months analysis confirms that we are coming out of the problems that we had with the pandemic. Okay, can you see based on your 12 months rolling, very beautiful here, Fiona, honestly. Although it's $1,000 or $400, but still, it is a good indication that things are coming back to normal, more or less, or better than normal, from what I see anyway. I think so, Maybe if you do a 12 months rolling over, let's say, from January 2019 up to June 2021, maybe you'll get a different picture.
Yeah.
Maybe, I'm not sure. But what it shows is that for 12 months, Jan 2020, June 2021, we are coming out of the problems. And then your 6 months, if I remember, it shows that, okay, we are also coming out of the issue. Yep. And the 3 months confirms, The 3 months shows that the last 3 months, everything seems to be, although massive lockdown, that that picture showed that, yeah, we are definitely coming out of the problems. So that's all the comments you got to put.
Okay.
Yeah. So that's all. Huh? You just need to comment.
All right.
And then you can move on to the next next slides. So what I would suggest you do, Fiona, to make sure that everything flows nicely. Make sure that you group all these slides together, which means you went through the PESTEL first, right? The politics, economics, all that. You finished up to environmental. Then now you are looking at your brand. You're analyzing your brand. So immediately after all these graphs, you put your brand slide.
The comments.
Yeah, the comments and all that. Yeah. Then after that, you can look at competition. Or you can look at, let me see, where is patient analysis?
Patient analysis, it's here.
That's customer, right? Is it customer?
Yeah, customer and patient.
Customer and patient, yeah. So you do the patient flow as well as the channel analysis and all that before this slide.
Okay. So this slide will be roughly the last lah.
Yes, yeah. You can put it last. You actually can put it anywhere. It doesn't really matter. But the flow will be better if you put this last. So first you do your brand analysis first.
Yeah.
Then you do your competition analysis. Then you do your customer patient. Then you are flowing very nicely.
Okay.
Yeah. So before this, let's go to okay. So after this slide is what? What's the next one? So this, all this is going to come under your channel, your customer. Your customer / patient. Because this customer, so your channel analysis.
Okay.
Actually, this is not channel. This is customer, but you are looking not at channel but geography.
Okay.
Okay. So this comes under customer also. The next one. What's the next one?
Next one will be also
number of boxes.
Yeah. Number of boxes.
This one you're looking at quantity. But geographical area. Just now was sales. Just now was customer number.
Customer.
This one is customer boxes. I hope you have another one for sales value for Lexa Pro.
Sales value is.
This is sales value, right?
This is by channel.
But this is sales value, right?
Yeah.
This is value, in ringgit,
in
not
ringgit.
boxes or anything, right?
No, in value.
Yeah, so this is the value one. So now what I would also recommend, Fiona, can you go back to the previous two slides? Okay. Now, are these data from your own internal or is it from IMS?
Okay, so for number of boxes as well as number of customers is from the sales that usually we get every day. And towards the end of the month, we have like a list of all the sales, and then I pivot all the data, and then I can choose by state or by number of boxes.
Yeah, so basically what you're saying is this is your internal data, right?
Correct, the sales data from Zulik, I guess.
Yeah, so if you go to the next two, the third slide from here, okay, now here you are pulling this from IMS.
IMS.
Why aren't you taking your own sales?
Because IMS has a clearer, I can get like the different channels.
You mean you can't pivot from Zulik's data?
The data that I have, the details, right, is only name of the states, name of the customer, and then the name of the product, quantity. So there isn't any they don't separate it into like hospital or clinic or pharmacy.
Oh, so you are unable to use the Zulik data to pivot by clinics, pharmacies, and hospitals.
I don't think
you mean You mean you all didn't, or rather, Zulik's data, you can't map it by, clinic, pharmacy, hospitals?
No, the data that I have lah, I don't have it. I only have the name of the
You only got the name of the
customer lah.
customer, but not the category of the customer, the
No,
channel.
I don't have the category here.
Oh, I see. Wow, that's odd, huh? Okay.
Not sure whether is it my data or I'm not sure. Maybe I can check with Siu Hong to see whether is it possible to.
Can you check with Siu Hong? Because if you can do that, better to use your internal data than the IMS data. Because IMS data, you have to wait for 1 quarter to be over.
Yeah, correct.
That is the problem. So you don't have, more or less up-to-date data. Huh?
Yeah, correct.
So that's the problem with using the IMS one. Okay. All right. So this is Lexapro by channel. Good. So once you have done all this, then you go to the customer / patient, and then you put the comments in, whatever the comments. Before that, put also the patient flow just after this one.
After this, I put the patient flow.
Just after this, you put the patient.
Okay. So yeah, okay, I understand. So actually, right, can I have like the same patient flow for Brintalix and Lexapro?
Oh, I'm sure you should.
Yeah.
It'll be exactly the same. There won't be any difference. I don't think there'll be a difference. Because it is depression, right? Both are for depression. It is the same behavior that the patients and the customers will show. Now, before we go and have a look at that, can you go back to the very first customer slide? Okay. I just want to see. How many customers are we talking about actually for Lexapro in total?
Wow. Give me a minute. Where's my pivot? I have it in my pivot.
Okay. Roughly, Fiona, do you know roughly, or you can give a range? Is it 500, 600?
Okay.
300, something like that?
I think it's more than that. Because you see the
more
total.
Than that. Okay.
Yeah, actually you can see the total from here.
All right. Okay. So if we add that up, how much is it? You quickly add that up. 600. About 800,
800, yeah.
800. Okay. So 800, Fiona, my question is this, why is it, the reason why I'm asking you this, because when I had a look at Sue's data for psychosis, psychiatry, for antipsychotic, schizophrenia.
Okay.
Her data showed that in the south, there are more purchasing customers than the north, which for me was a bit of a difficult thing to understand, because what you are showing is depression patients you are getting more in the north than the south. That's quite substantial, 7% difference. If you go back to your Excel that you just showed, what was it? Like how many customers are we talking about?
Around 800, right?
North 200, south 144. It's about 60, 60 customers. And north is Penang and Kedah only.
No, Perak.
Oh, Perak as well. Okay.
So it's quite big. Perak is actually quite big. Yeah.
Okay. So then basically no difference. Okay, fine. Go to the next one, Fiona. Next slide.
All right.
Let's see what it shows.
It shows
14, 17. Okay. Number of boxes is the other way around.
Yeah, correct.
So why is that?
One of our biggest customer, if you remember, is the gastro liver and gastro clinic in Johor.
In Johor, okay.
He's our number one customer for example and brain release. Yeah. So for Northern, although you have like more customer, but then the number of boxes that they purchase is actually not a lot lah.
Now, I am also seeing something here, Fiona, because number of boxes, 60% purchased in Central, but in terms of number of customers is only 41%. Huh?
Yes. Correct.
Yeah. Okay. All right. And this data is from when to when?
It's until this year, January to June.
January to June, huh? Okay. So 6 months data. Yeah, so it's difficult to compare with the Q1 IMS data by channel because that is 3 months behind,
Yeah, correct.
Really can't make any comments on that. Can you just go to that slide?
But I guess it will still be roughly I think like for the private sales, right? Clinic will still be the one holding the biggest chunk. Even when we can see IMS Q2 lah, I think it will still be the same.
Now these clinics are what, Fiona? Are they specialist clinics or GP clinics?
Combination, because IMS they couldn't. I don't know whether they can or cannot, but I think we didn't pay for it lah to be more so specific, right? So it's a specialist as well as.
You mean the DDD plus?
Yeah.
Okay. That's by brick and all, right?
So we have one. The only ones that we can do is private. We can break it down to the hospital, clinics, and pharmacy. That's all. I can't break it down into clinic or whether it's GP, private psychiatrist. I don't think.
Now I think this is one question that we probably discussed during one of our earlier sessions, Fiona. Do GPs initiate therapy for depressed patients?
Yes.
They do, huh? Okay.
They do, but it depends on how severe. And
how severe?
Also, yeah, and also for our Lexapro sales, right? Mostly the GP they are actually using generic, not the original one. Definitely comes from our psychiatrist private clinics lah. Okay,
so that means what you're trying to tell me, Fiona, is that this clinic, the 50% by the channel of the clinic, how many percent of that can you say is actually specialists?
I would say
is
around.
Is it 90?
Yeah.
90?
90 plus lah. 90
plus.
Okay. Plus percent.
All right. Okay.
GP is not really.
Yeah. So what you must do, Fiona, now you are bringing up something which you didn't mention earlier. So you should mention this in your
brand.
Under your brand. Yeah. So under your brand, you must say that GPs in Malaysia, they are comfortable, initiating therapy for, depressed patients, but almost all of them, you can say almost all of them use generics. And Lexapro sales is in the clinics is, as you say, 90%, 95, whatever, is all specialists.
Okay.
Specialists still prefer branded, antidepressants.
Okay.
Hopefully, lah. Okay.
Hopefully.
Yeah, hopefully. Yeah. Okay. So good. Yeah. So just make that comment there, because this is the thing, Fiona. Because one of the things that sometimes this is from my experience, Fiona. When we work with our colleagues who are in Europe, the situation in Europe is very different from in Malaysia. In Europe, first line therapy is everybody has to go and see the GP first.
Oh.
And the GP will always initiate almost all the diseases, almost all. And when they cannot manage the patient, then they will refer to a specialist. Not like Malaysia. Malaysia, I can go anywhere I want.
Yeah, correct.
So you must always remember that your colleagues are thinking like that, They are thinking that, Malaysia's situation will be like what they are facing there. So they will be trying to tell you, why don't you push more GPs to initiate with, Brintellix, for example.
Cannot.
So they don't understand that, you see.
Okay.
They don't understand that no, GPs here, not all GPs are comfortable initiating for, depression. Some of them feel that, depression is too tricky for them to manage, because we're talking about brain and all that.
Yeah.
So they send it off to a specialist. They don't want to touch. Okay, so that's so important for you to put that down there. Just in case you get a new regional product manager who comes from Denmark or who comes from UK or Australia, and then he or she will start questioning you. Why so few GPs use Lexapro or Brintellix? Why don't you get more to use?
Okay.
They will start asking you these kind of questions. They will, Fiona. I'm telling you, these guys, because they are coming with that kind of thinking here, and therefore they're going to be asking you these questions. So you got to be prepared with this, challenge, to challenge this. Okay, very good, Fiona. Let's move. Just one other question that I have for you, Fiona. Can you go back to the previous? Okay. Now, are you able to see whether this quarter compared to last year, if you look at the MAT data for Lexapro in the IMS, is it almost the same like this in terms of percentages? Clinics, hospitals, pharmacies, is the distribution about the same? Any idea?
I have to check.
Okay, just check that and see, Fiona. If there is no change, if it is exactly the same, and if you can also see, so that's one. Second thing is try to find out whether MAT for each one of these channels, what the growth rate was. Is it growing? Is it stagnant? Is it whatever?
For different channel?
Yeah. So then you get a really clear picture about which one of these channels is really growing.
Yeah. Okay.
And therefore that will give you an idea for your action plan, where to put your money. Should it be a hospital? Should it be in pharmacy? Should it be, clinics, or should it be something else?
Okay.
Yeah. So that will give you an idea what to do. So that's my final point that I want to make, Fiona, about why we do this situation analysis. The only reason why we do situation analysis is two reasons. One, to find out what the budget should be for next year or the target. Number two, what plans should we create for next year? That's all. Only two things, We do all this work only for two things.
Okay.
Okay, that's all. But to get to that two things, we must do this, because this is the foundation. If the foundation is not correct, then your building will collapse. Yeah. So we are just preparing ourselves. So that's why we do this. So we become like construction workers, make the foundation work. Spent a lot of time on the foundation so that once we set up the structure, very fast.
Okay.
Have you, Fiona, ever seen a building being made? A multi-story building, a high-rise building being made. Have you ever seen?
Roughly.
Roughly, okay. I had the opportunity, Fiona, way back in 1990s. My office room, right next to it, they were building a high-rise, I think a 30 or 40, 20-story building, okay? And I can tell you, for easily, Fiona, 6 months, they were just doing the foundation. 6 months, just digging, and then pouring the concrete and all that for just the foundation. Once the foundation was set up, Fiona, the next 6 months, boom, 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 they put the 20 stories. Almost every day, one floor, or every week, sorry, not every day, every week, one floor.
Okay.
But the foundation, wow, they spend so much of time. You look at it like, hey, nothing happening here also. Just digging only.
For 6
Yeah.
months.
So same thing we are doing. We are this situation analysis is our digging job, doing the foundation. Once we finish this, Fiona, what you will find is that we are going to, after the SWOT analysis is very fast, and then setting the budget, setting the action plan very, very fast. Everything will be done very fast because we have all the information here already.
Okay.
Yeah. So this is where we're going to spend a lot of time. Once this is clear, very fast. Subsequently, we can get the other things done.
Okay.
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 All right. Very good. So let's move on, Fiona.
Next
Let's
one.
see what we are. Okay. Let's have a look at this. All right. So 80% don't seek treatment. Okay, how do you know this? That's what we have to ask ourselves. How do we know this?
How? So I think I actually Googled the number of population.
And this information came from which source?
Yeah. Let me find again. A lot of sources. A lot of
sources. Okay.
Yeah.
So good. Yeah. So did each source say that 80% don't go for treatment?
No, actually they only mentioned 20%. I think one of them only mentioned roughly around 20% will seek treatment. So the 80% is I assume 100% is 500,000. So if 20% of 500,000 seeks treatment, meaning to say the remaining 80% doesn't.
Okay, all right. Yeah. So what you must do, Fiona, this information that you're just telling me, 20% seek treatment according to who? What state that source? That must go into your social slide. Just the information, only the information.
Oh, okay.
Okay. So under the social, you can say only 20% of Malaysians, seek treatment for depression. And what does the article say? Why only 20%? Is it because they can't afford, or is it because they are shy? Stigma, all this kind of stuff. That's all. You just put there. Huh?
Okay.
So somewhere you must capture that. All right? Okay. And then, so 100,000 patients. And how do you then decide to distribute among the GPs, private hospitals, government hospitals?
Based on IMS sales.
Good.
So the total sales, I just check on, because IMS you can see clinic, hospital, how many percent. So I just put it in here.
Okay.
The percentage.
Very good. So that's very clear. So just now also remember we discussed that. Hang on. So now we are coming to another thing, Fiona. Between the GPs and the specialists, how many? Oh, so that's 30%. So 30% means 30,000. Out of that 30,000, how many percent have their treatment initiated by GPs? How many percent by specialists? Now we are going back to what we discussed earlier about the situation in Denmark, in US, Canada, and all these other countries. That in those countries, it is GPs who, I think about 90%, in fact, it's almost about 100%, of everybody must go to GPs first. Then only they get channeled to the specialists, whether specialists in private or specialists in government or, or the private specialists. So Malaysia is going to be very different. So that's what you need to find out,
Find out. I need to find out.
Yeah. So what you can do, Fiona, again, go back to the same specialist that we talked about earlier, and just find out from them, Doc, can you just, tell me how many percent do you think, although they are specialists, you can ask them, how many percent of depressed patients initiate therapy, diagnosis and therapy with specialists rather than GPs?
Okay.
And then if they are diagnosed by GPs the first time, do the GPs initiate therapy or do they refer to you?
Okay.
So just check with a few of them and then just use those numbers, like average it out and use that numbers. Because in Malaysia we don't have such data, you see.
Yeah. Treatment. Okay.
All right. Okay. Good. And that information, Fiona, also put under your let me see, under your customer slide.
Customer.
That this is how GPs, when new patients come, uh, they are either diagnosed by GPs or specialists, how many percent by GPs, how many percent by specialists, and what do the GPs do? Do they initiate, or how many percent initiate, how many percent, just refer to the specialist? They don't want to touch. Yeah. So then it becomes very clear. Then you know where to focus also,
Okay.
So even if, let's say, Fiona, one day, Kinsang tells you, okay, now you're going to launch a new antidepressant in Malaysia. You know exactly who to go to. When you create a launch plan, should I focus on GPs or should I just focus on the specialists?
Yeah.
Should I put all my money there? Okay. Yeah. Okay. Very good, Fiona. Let's move on. Any questions?
No.
Okay. All right, Fiona. Shall we continue? Okay.
Yes.
Great. Okay. So tell me, what have you learned so far, Fiona? Have you learned anything today?
Let me think. Yeah. Actually, the important thing is finding information is one thing. What the information useful for is another thing.
Exactly.
Yeah.
That's the more important thing. Yeah.
And the data that you have, you need to understand why is it like this and what is the story behind it, which I find it's not very easy to do.
Sure.
Have a story.
Well,
Yeah.
And what's the reason you don't have the story, Fiona?
I would, especially with sales data, I would think that I am still not very familiar with the market.
Exactly.
Yeah, so not very familiar, and then I am not really exposed to the field yet.
Yeah.
I think that's why I don't spend enough time on field with the doctors.
Yeah. Yeah. So and therefore what should you do when things
gets better
moving forward? Yeah.
Yeah. I think I'll go more.
Yeah, exactly. Yeah. So when you go out more, Fiona, you must make it a practice to make solo visits, not just all the time with the sales rep.
Yeah.
Because sometimes, when you go with the sales rep, doctors may not be very open with you. Or they may tell you things that they are trying to make, the rep feel happy about. But when you go alone and see the doctor, then you can really have a very good discussion going. And I don't know what formula Kinsang has for y'all, but in the past, I used to insist that my product managers at least spend 30% of their time meeting customers.
Okay.
So 30% means if you got 20 days, 22 days working, then about 5 to 6 days a month in the field. So in the field can mean working with the rep or alone meeting the customers.
Yeah.
So when you do something like that, then you will really you will have the information at your fingertips. And then nobody can challenge you because you can say, well, that's what this doctor told me.
Yeah.
But for now, Fiona, you still can do certain things, even though you can't go out physically meeting, you can still pick up the phone. You can still, send an email or WhatsApp message. And you can also do simple surveys, Fiona. Like, for example, just now, we wanted to find out how many GPs actually are comfortable diagnosing and initiating therapy for patients who have depression. What you can do is you can, the GPs who are buying your products, right?
Yeah.
If you can identify them, if you know who they are, at least just among the top 20% of your GPs, you either can send them a WhatsApp message or you can send them an email or you can do a very quick survey, either using Survey Monkey or you use the system that you all have. Yeah, I think it's Avis, right? Your system is called Avis.
Yeah.
Aviva. Use Aviva. Just send out an email and say, Doc, I just want to find out. Just ask 2 questions. Do you diagnose depressed patients and do you initiate therapy? That's all. So based on a number, you can more or less know, okay, how many % are comfortable. That's all. So very fast you can get all the data. You don't even have to go out to the field. Yeah. And then it's up to you whether you want to reward them with something or if you don't have anything to reward them with, then don't say anything just tell them they're doing you a favor. You're new to the company. You do me a big favor if you help me out here. So just tell them that please help me out. I would like to understand the market and take it from there.
Okay.
Yeah. So at least you will instantly get some reply.
Okay.
Yeah, and you can do the same with the specialists also. To find out whatever you want to find out. Even the green ribbon thing and all that, you can probably find out from them, or the NGOs who work in mental health. What kind of impact they have.
Okay.
All right. So very good learning points, Fiona. So I'm glad that you pointed out that information, you're not supposed to just put information inside here. Only relevant information and state how it impacts mental health and your product. Yep. That's it. Anything else not relevant, don't put inside there. Otherwise, you will have 100 slides. And I'm not joking. One of my product managers did that. Because she was not used to doing marketing plans. So when she was doing the situation analysis, that was 80 slides, Fiona. So she put everything inside there, political situation, all. So very unfortunate. So we had to get rid of a lot of things. Yeah. So good. Yeah. So that has happened before. So that's why I'm telling you not to put irrelevant information. Okay. So let's move on, Fiona. Okay. Let's see. Okay. Customer patient. What have you got here?
So I just roughly explain main contributors from the example from the whole nation, like Northern, the sales mainly contributed by Penang and Perak. So in Penang,
hold on, I have to stop you here, Fiona. Read the first sentence again, Fiona. The first bullet
main
point.
Contributors of, for example.
Yeah. Read that again.
This NGP.
Okay. And what do you notice there?
GPs.
Yeah, so it's not GPs, we just discussed, right? Yeah.
Yeah.
So it is a specialist actually.
Private specialist. Why? Okay. Private.
So main contributors are private specialists. Who else?
No.
Private hospitals.
Private hospital also not as much as private.
Okay. Okay. Fine. Okay. Yeah, and then you are going on to say
just
by region. Okay. Sure.
By region. So I'm not sure whether it's important. If not, then I can just take it out.
Maybe too many words, Fiona. What you can just probably put bullet points, and because you already have the graph there, so you don't need to go through the whole thing again by stating it. You can just say the main areas are where, central, and then what? Johor, north and south.
Okay.
These are the main areas.
Main areas. Okay.
All right. And if you are able to, by the areas, do you have channel reports by areas, central, breakdown by specialists and all that?
No.
Do you have?
I don't have it.
Don't have. Okay. So then just give a general overview of which are the main geographical areas that you get Lexapro sales from. So it's going to be central, south, north, and then south.
Yep.
That's it. So other areas all are not important, huh?
Yeah, not
okay. So yeah, especially if the sales manager who is responsible for Kelantan comes to you and says, Fiona, we need to have activities there. And then you can take this marketing plan and sit down with the sales manager and say, hey, only 1% of sales coming from an area.
Yeah.
So how can I put money there? So that's how this whole thing works, Fiona. So I hope you can see, this marketing plan is a plan that is practical, not theory based.
Yep.
It is to defend your decisions, your action plans.
Yep.
So that's how we use it, Okay. All right, good. So next one.
So next one I explain because it was also told that since MCO medical tourism was impacted, it's still impacted. So the sales from Sarawak, Penang, and Malacca, you can see a drop. Yeah, even until now, although Penang apparently, anxiety patient, there's a pickup of local patients, but still the sales cannot compare to those who come in from overseas lah.
Okay, all right. The next point. Okay, fine. Okay, GP comfortable. See, so that's what we have to get some data on. How many percent? How many percent of GPs are comfortable treating depression? Because it may be a small amount. We really don't know at this moment. So just need to verify that. Maybe true, maybe not. May not be. I'm not sure. So. Okay, for clinic sales, 90%. Okay. Central. Okay. East Coast. All right. Okay. What is the other thing? Yeah. So your patient flow is somewhere before this, right?
Yes, it's before this.
Before this. So your patient flow, just make a comment about the patient flow about, oh no, you have already commented under social, right? Why only 20%? So that's, that's fine. You got nothing else to comment about that. Okay, good. So we can move on. So that's good. We can just leave it like this.
Okay. So then next will be Brintellix video.
Okay, so next Lexapro. So Brintellix also the same, exactly the same, right?
Yeah, exactly the same.
More or less. Oh, wow, look at Brintellix. This is 12 months.
12 months.
Wow, why is Brintellix behaving like this compared to Lexapro?
Actually, for the past, I think last year, wait, let me see whether I got the data here. Last year, they were actually focusing quite a bit since 2 years ago in MOH. So we have this quota.
So Brintellix is MOH.
No, the main contributor is definitely private. It's just that they berjaya to break through in MOH, increase awareness, and then got quota as well. Number of quota is increasing.
So this is both private and government, right?
Yes.
Okay. So hang on, before we look at this, can we first of all, how old is Brintellix, Fiona?
Around 7 years lah. 7 years.
7 years. Okay. So just like for Lexapro, you need to show the 5-year sales versus target, 5-year growth. What else? Yeah, these two.
5 years.
So do you have the data with you?
Yeah.
So 5-year-old product or 7-year-old product growing last year at 22.5%. Beautiful.
So
really nice.
I will separate this out.
Oh,
so
okay.
The teal color one is actually going up.
Very nice,
Uptrend.
In fact, both of your products. So the Brintellix one does that include PharmaServe as well?
I have to check. So for this is the older. I will check. Okay. I think I didn't include, but if I include, it will still be uptrend.
Right. And what about the growth rate over 5 years, Fiona? 2020 over 2016?
Let me see. Growth rate. I don't have the data.
I'll tell you what. Can you go to that slide just now? You showed the graph with Brintalix and Lexapro.
Can.
Yeah. So what is 2020 sales?
Okay, 2020 it's around 7373652.
Okay, divide by 2016 sales. Let's see how the growth is.
2016.
Yeah. How much is that? 2016? 1.9. Okay. So how many percent growth is that?
400.
400%. So yeah, wait. Is it 400% before you minus the 100% or after minusing?
After minusing.
After minusing. Wow, 400. That means 4 times. You grew by 4 times. Wow. And Lexapro is how much? 12 over 10. That's about 20% also.
20%.
Wait, 20%. Wow. That's great, Fiona. Old product growing at double digit, Really good, really. I'm really impressed. I always believe that old products can still grow. Okay, you guys have proven it. Wonderful. Okay, so good, So include those data as well, What's the growth rate? What is your performance? 5 years sales versus target. And then we look at the rolling sales. So this is 12 months. What does 6 months and 3 months look like?
It looks like this. 6 months Brintalix. Yeah,
okay.
This is
very good,
So the drop is obvious last year MCO, then it just went back up.
Yeah, and it never went below that.
No, yeah.
Yeah, and then 3 months.
3 months. It was
3 months. Look at 3 months. Why is 3 months like this? Is it because of government tender?
No, we don't have tender in government for Brintalix.
What about LPO? Are the LPOs big?
No, ours is only quota though. Quota.
Right. Okay, so not predictable. That means something else is happening every 3 months. What do you think is happening, Fiona? Why is every 3 months it's like yo-yo, up, down, up, down, up, down, up, down. The 6 months one looks much better. This one looks like a bit weird, A bit
weird.
Yeah, but then again, Fiona, if you look at it carefully, we are talking about Feb 20 to April 20. That's about $500. This in thousands, so 40,000 versus 80,000, double actually, Something weird is going on.
July, then it went to.
Then went down.
Yeah, the down part is usually, if we look at it, is like this is MCO. This is also when we are actually slowly recovering.
Okay. Goes up a little bit, goes up, and then comes down again.
July, I'm not sure what happened in July. Not sure.
Then it goes up very high. The next.
Then go up, then
come down.
Now, this part is when we had this year MCO, right?
Yeah, I think so. But then you see, Jan 21st to March 21st also MCO, but it went up again. So I don't know whether this is because your customers. Do you have more customers for Brintalix or Lexapro?
Number of customers.
Yeah.
I think it would be like Zapro for sure.
Okay, so therefore, Brintalix, how many customers do you have? Just now, I think for Lexapro, we saw how many customers?
Around 800.
1,000. 800.
800.
So that means Brintalix would be how many customers?
4, 6, 7, 8. Similar.
Also 800 Brintalix customers. Oh, that's weird. So why is it? Because with Lexapro, we didn't see this kind of graph.
Yeah, maybe let me check again.
Yeah, just check and try to see if you can get some input from the sales manager why this is happening.
Yeah.
Something very weird going on. Either the only thing I can think of, Fiona, is that your customers are buying every 3 months. That's all I can think of. So they are buying every 6 months actually, not every 3 months. So they buy, Jan to March. Then the following month, the following 3 months they don't buy, and then they wait for the next 3 months they buy, and then they don't buy, then they buy again. That's the only thing I can see, which means it is probably that Brintalix is much slower moving compared to Lexapro.
Yes. Okay.
Is that correct?
Yes.
Does your sales show that? That Lexapro is much bigger than Brintalix?
Yes, Lexapro is very big. Brintalix
much bigger.
Cannot cover.
All right. Okay. So maybe that's part of the expression, but we are still not sure. But just check in with the sales manager and see what they say. Show them this graph and ask them how would they interpret this. Yeah? Okay, great. So let's head back to our slides again. Right. Yeah, so same thing, Fiona, for this slide, just like for Lexapro, do exactly the same, the same format. All right, okay. Then next.
Okay. Next would be to show the sales from private versus government, like 2019 to 2020. What is the so you can see like from public, right? There's an increase in terms of sales.
What's the reason for that? In terms of value, did that increase?
Value, yes.
It did, okay.
Yeah. But then this private also includes MOE.
Okay. So private is in MOE here. Okay. All right.
So if
why is private here including MOE?
Not private, public.
Public includes MOE, okay.
Yeah.
Okay, good.
So this is for government, remember that day I said I suspect that the sales in government increase. So then I went and find out really increase. Even the quota, like we are listed in a lot of government hospital already, and we have government hospital buying but quota basis.
So between MOE and MOH hospitals, how many % does MOE contribute?
MOE, but we only have 3 MOE. So if you can see from here, MOE is around 16%, but we only got 3 MOE.
So 16%
from 3 institute.
Oh, MOH is still the bulk, 74%.
74, but then we have a lot of MOH.
Yeah.
Centers, yeah. So if I would think MOE is still the main contributor for Brintalix if we look by number of institute.
But you got to be careful, Fiona, because ultimately the number of that means the number of patients who are going to MOB will be less than MOH.
Okay.
Because simply because MOH has got more centers, and therefore they cater for more customers. So your sales value will always be more from MOH than compared to MOE. So sometimes it's a bit risky if we try to break down sales per institution.
Yeah.
Because the danger here is that if you do an analysis like that, then the sales manager can come and tell you, please put more money for University Hospital, UMMC, because for each psychiatrist there, you get more sales. But the danger is, no matter how much more money you put, that UMMC will always have a limit. You can't grow any further.
Okay.
Compared to MOH. MOH, because they got much more patients than MOE, they will keep growing. That pie will become bigger in the MOH compared to the MOE.
Okay.
Because MOE, you're only talking about 3. I mean, how many institutions? 3. That's it, maximum. You can't go any further. And the number of doctors are also going to be, psychiatrists are going to be stuck with whatever they have, which means they cannot see more patients than what they already do today, maybe 10% more. And therefore, your sales is never going to go that much more compared to MOH. So that's how you got. Yeah.
But if MOH is based on quota, right? Let's say one hospital maximum that I know of is okay, like HBUK, there's no quota. Shah Alam 30, but some, they have only 10 quota or 5 quota. So
we have to find the MOH hospitals with either no quota or larger quota.
Okay.
Unless the reps are coming and telling you we have gone into all the hospitals who are going to use.
Okay.
If they tell you that, then okay, yeah, then you got the quota which is limiting you. So then you have to decide, okay, how are you going to distribute your action plan between MOH and MOE?
Okay.
Yeah. And then ultimately also MOH and MOE are just 18% out of the whole pie.
Yeah.
If you look at it, the whole pie, the bulk is in private sector, not in government. Unless you get the tender.
Yeah.
Okay, very good. Okay, fine. This is good.
So if I put this thing here, right, would I be challenged seeing that? So why not we focus on MOH more?
Just like I challenged you just now, Fiona, because that's what when I look at it, that's what I see also. Because at the end of the day, you have to look at patient flow, but you have a condition there which is quota. You can only use 10, you can only use 30. Some say, okay, no problem, you can use whatever amount that you want. But also, there's this other thing also. Today the quota is 10. Maybe next year quota can increase to, I don't know, 30 maybe. The guy who has got 30 this year can go up to 50 next year.
But they also can slash the quota.
They can also slash, yeah. So you can go either way. So that's where we have to be really, we really need to understand what will happen. What will happen in MOE? What will happen in MOH? And if we say that even if MOH is going to slash, how much is that going to be compared to MOE? Even if MOH slashes 10%, Fiona, MOH is still bigger for you.
Okay.
Right? Much bigger, right?
Okay, because MOE is paying, right? Patients are paying.
Okay. If MOE patients are paying, and then you had also put earlier under the social and economics that patients are losing their jobs, they got no money, all of them are going to rush to MOH.
Yeah.
So which means your MOE is going to reduce, not increase,
Yeah.
You're going to have a reduction there.
Yeah, possible.
And if the quota in the MOH is still the same, then of course the MOH is not going to increase, but your pie is going to reduce because you lose the MOE guys. So MOE is going to shrink actually, not even maintain also.
So
that could happen,
So I will have to find out from the specialist in MOE whether the number of new patients that are going remains the same before this whole COVID thing.
Yeah.
All right.
Yeah.
If they say the same means
If they say the same and MOH also remains the same, what does it mean? Huh? Where should you put your money in?
I'll put it in MOE.
Why? Will the MOE grow? If MOE is not going to grow, MOH is not going to grow, then you should be very conservative in how much money you're putting there.
Okay, so I have to put more in private.
Definitely, because private definitely will grow. Private may also decline, because that could be a big danger as well. But how many percent of that private is actually hospital? Based on your data here,
Around
19% is hospital, and then that clinic, how many percent is specialist? Clinic specialist.
Rentalist, I think majority is specialist.
I mean, just like Lexapro.
Lexapro, yeah.
But this is probably almost 100%, almost. Yeah. Now, the thing is this, usually, people who go and see the specialist, they are, maybe they're M40 and top 20, they are not, they probably have their jobs. I'm not sure, I'm just guessing here. So don't think that I've got some data here. But what I hear is that the people who are losing their jobs are the bottom 40 people and the lower M40 people.
Yeah.
So these people who cannot go and see, I mean, the bottom 40, they don't go and see specialists. They all cannot afford to see specialists. So those guys are definitely going to rush to government hospitals. And government hospital means MOH. They won't go to MOE because must pay. So they can't afford that. Maybe the guys who, the lower medium 40 who used to see specialists, because they got lower income, they may go to UMMC or they may go to MOH. We don't know. Okay. So if they go there, then the question is, what will MOE use? What will MOH use? Will they use Brintalix or will they use something else?
Okay.
But based on our earlier analysis, MOH is probably not going to get more money next year.
Yeah.
So the pie will probably remain the same or maybe even less. So now you guys have to think, what will happen with MOE? Will it increase slightly or remain the same? So that will, give you an idea about where should you put more money in, MOE or MOH?
Okay.
Yeah? So the question you got to ask yourself, Fiona, is if I put $1 in MOH and I put $1 in MOE, which one will give me more?
Okay, MOH.
That's where you should put your money, Simple, that's all. It's just a numbers game, nothing else. And then, of course, the other question, if you put $1 in private sector, $1 in government, which one will give you more?
Private.
So that's the answer, Very obvious, right? Yeah. Okay, good.
Okay.
Right? Moving on. What's next?
On will be the situation analysis.
Okay. So even this slide, just like for Lexapro.
Yep.
Do exactly the same for Lexapro.
Yeah.
Right?
Exactly the same. Okay.
Now, just one comment, Fiona. You have put here under bullet from the bottom, bullet point number 3. You are saying there are more relapsed MDD patients.
Yeah.
How many percent is that, Fiona?
I will have to check because this sentence was actually mentioned by a private practice psychiatrist.
Okay. So even then, go back to that guy and ask the doctor. Doctor, when you say more relapse, how many percent are we talking about? Out of 100 of your depressed patients, how many percent actually relapse? And then you check with a few people, see what they say, and then you just take the average.
Yeah.
Okay. Now, the impact of that for you, Fiona, the way I see it is that your good friend is going to cannibalize your patients. I think so. Maybe, or maybe I'm wrong. Maybe I got it wrong. So these patients, they are perfect for Resulti, right? The relapse guys?
If they are resistant towards all the monotherapy, then yes.
So that's your next question, Fiona. Why do patients relapse? Is it because non-compliance? Or is it because the current therapy is not effective anymore?
Right. Why patient? Okay. I think I remember like doctor saying because I spoke to him during this lockdown. So he mentioned that we asked, so how is the situation like, in lockdown? You see a lot of patients, and he say, he see more like, patients, relapse patients are like coming back to him. Those like who have already been quite stable, and then they had a relapse. Yeah. So I'm not sure whether why the patient, like the exact reason, is it purely because of COVID or lockdown or losing their job?
So you need to ask the doctor, Fiona, what's the reason for the relapse? Is it because non-compliance? There are actually only two reasons, non-compliance or they are not, or the medicine or the drug is not working anymore.
Not working.
Yeah. So they are stable today. They are taking the medication. Everything is fine. And then because of COVID, they lost their jobs, and therefore, the current therapy, their depression becomes worse, and therefore the current therapy is not working. So that could be that reason. So there could be some reason. But anyway, what will they do with these kind of relapse patients? Are they going to continue with Brintellix, or will they add Resulti? If they continue, no problem for you.
Yeah.
If they switch, got a big problem for you.
Yeah.
so yeah, if that is the case, then you are not competing with Sue. She is, it's additional business for her, but for you, no issue. You still continue.
Yeah? Okay. Yeah.
Okay, good. So the relapse patients, I don't know whether relapse patients are actually a problem for you or not, or how they are going to impact your sales.
If the relapse patient, they have been taking SSRI, and then they relapse, right? So usually doctor will switch to another different category, and he can switch to Brintellix. Definitely.
Switch.
So it depends on what is the initial drug that the patient is taking.
Okay, I got it. Okay, so that's why you put it there, for switch. So that means basically what you're trying to say, new patients can use Brintellix, and Brintellix can switch patients as well. Okay, got it. Understood. Okay, good. Right. Next
will be the situation.
So you created a table for this. Don't forget to put the sales data here also, the interpretation.
There's the sales.
Yeah. So why are you showing both the products here?
Yeah, I know I'm supposed to split them up.
Yeah, so just split it up, lah.
Yes.
Just make a comment that 9 reps are promoting both Lexapro and Brintellix. Put it on the Lexapro slide, put it on the Brintellix side. And then you just state how many % of their time are they supposed to spend on Brintellix, how many % on Lexapro. That's all. So at least and you can remember, okay, they're supposed to spend more time on Brintellix, less time on Lexapro. I hope so.
Yeah, it is. They are doing that.
Okay. Total market. Oh yeah, I just remembered something. We didn't see the market share report for both Lexapro and Brintellix. What is the market share report? What is the market share?
Market share in private, let me see. Okay, so for Lexa Pro will be 22%, but this is just MAT Q1.
Do you have MAT Q1? Okay, fine.
So,
MAT Q1.
Yeah, so this is so Lexa Pro is around 13%. Printer is around 13%. This is total market lah.
Right.
Yeah. So in
total market means private and public.
Yes.
Okay.
Combined lah. So Lexa Pro is 22, Printer is 13.
And what is that? 19%?
Remeron. Yes.
Remeron from who?
Remeron is from Menarini.
Okay.
Yeah, Menarini, but I don't think produced is by Merck, but Menarini is.
Right. So can you go back to the previous slide? Now, what I notice here, Fiona, is that Rentlix is number 2 in the private market, 5 in public. Right. Okay. Fine. Okay. Just leave that like it's okay. All right. Yeah. So just put so you got the market share. Just put within brackets. Within the brackets, when you put the ranking there, just put within brackets next to number 1. The percentage, so that you know that is market share, lah.
Okay. Okay.
Okay. Good. Okay. Good. Maybe you want to do something else also, Fiona. Maybe you want to put ranking. You want to put another row, ranking total market. Below the ranking in public market, you want to put another row, ranking total market.
Ranking in total market.
Because your ranking in total market would mean the Lexa Pro is number 1. Rentalix is number what? 3.
Yeah.
Number 3. Okay.
It's above is below here.
Oh, all right. Okay, you got it there. Yeah. So just put the market share in brackets, lah. Okay. Okay. So what you should do, Fiona, that row, instead of writing total market in value ranking, just put there ranking total market.
Okay.
Okay, very good. Okay, let's move along. Price, okay, you got the price there. Is that 1 month's price? 1 month's therapy price?
Yeah.
Okay. Do you have any special pricing for Lexa Pro and Rentalix? If you have, do you have tier pricing? Means or quantity pricing, you buy 10 boxes this much, 20 boxes that much. Bonus scheme.
I think they got I am not sure on how they work on the bonus. Wasn't briefed. But I think they do have it, I think.
Okay.
I have to check with the sales manager.
Yeah, so you need to know that, Fiona, because ultimately you are the one who is responsible even for the bonus systems and all. So you need to put down all the different types of pricing that they have, because ultimately it's marketing that should be driving this whole thing. Based of course on input from the sales guys and all that. So pricing is going to be a responsibility of marketing as well.
Okay.
Yeah. So capture that information, put it here also. What are the different types of pricing that you have and all?
Okay.
All right. Now, very good. So let's have a look at what's next after this. Competition. Yeah. Okay. So you got a table as well. Very good.
I didn't put the market share.
Put the market share. Yeah, you did. Did you? Yeah. Okay. So here you got the market share separate from ranking. Okay. So Remeron, they come in two. Why do you have two columns? Remeron?
Remeron. Oh, one is private, one is public.
Okay.
Because their market share is different in private and public. So
Right.
the biggest would be in public.
Yeah, so look, if you look at this, Fiona, tell me who is your competition?
Remeron.
In private or in public?
In public for Brintalix.
Yeah. In private?
In private, Lexapro.
Yeah, exactly. In private, it is Lexapro. So you got, which means you got to make sure that your positioning is very correct. Otherwise, you're going to have one fighting with the other.
Yeah.
You know? So it has to be very clear in the rep's mind. When I go and see this type of doctor, this is what I must do. When I go and see that fellow, this is what I must do. So very clear, they must be in their mind. Yeah. Yeah. So we'll come to that. Don't worry, we'll come to that. So yeah, I just as we had that discussion that day, I don't think Menarini is really your competition. Because in the public, what are you going to do, Fiona? At the most, it is price issue, right?
Yeah, price and they recently got the tender for 2 years.
Yeah.
Yeah, so I think for them it's quite steady, even though they have generic.
Yeah, so this is something you must put in the competition slide. So have another somewhere here. You must say.
I put the additional info.
Okay, good. So that they have got the 2 years tender, which means for the next 2 years, you shouldn't be spending much money in MOH.
Correct.
What are you going to do? Nothing. You can't. You put low amounts of money, CME maybe, low expenditure, just to keep the doctors, to let them know, hey, I'm still around. So that when it comes for the new tender, then you all can decide what you all want to do. Should you or should you not? And the price, where do you put the price, Fiona?
Yeah, I haven't got the price yet.
Okay.
Yeah, I haven't found out like the price for our competitor. But I'm sure it's in my office somewhere.
Okay.
I'll put it on my wall or something.
Okay. So looks like Abbott is your number 2 competitor in public. And are they actively promoting Luvox?
No.
Is it a new product or old product?
It's very old. And
so yeah.
The reason why they are still using it because they are priced at apparently very cheap. That's why MOH say, why not I just use original product since it's so cheap, right? Yeah. So they are not pushing it at all.
Yeah. So this is where, Fiona, your job as Brintalix product manager, based on all this data, this is where when the time comes when the government asks for tender quotations, this is where you probably have to go to either regional office or head office and argue with them and say, do we want this market or do we not want this market? If you want this market, then this is the price we need to quote. Are you willing to play the game or not? Because without the right price, you can't do anything.
Yeah.
It's just wasting all your time, is it? Yeah. So that's where you have to go and say, look, it's a price issue, nothing else. Unless the government give the specifications, which is only for Brintalix, then then you can go in, you see, without any problem, at a higher price than Remeron or Luvox.
I don't think Malaysia works like that.
Is the specification for Brintalix much better compared to Remeron and Luvox in any of the parameters?
You mean in... Yeah, definitely. Actually, Remeron, why they are using is because of the side effect of this drowsiness. Because a lot of depressed patient complains that they cannot sleep. So doctors will think, I just give you Remeron, one tablet, solve your depression, and then solve your insomnia.
Okay.
Yeah. So that's why public loves to give Remeron. Yeah, actually, the way they sell it is using drowsiness as the selling point.
Yeah. So what that means, Fiona, for you, is that between now and the time that the government calls for tender, you have to go to all these MOH specialists and ask them, tell me one good reason why you will use Brintalix compared to Remeron. Just ask that question, just one question. And if nobody can tell you why they are going to use Brintalix, that means you got no market there. If all of them tell you, no, Fiona, yes, your product is good, but for me, the most important thing is to help these guys handle two problems, insomnia and depression. As long as Brintalix doesn't have that, I cannot use Brintalix. I cannot use Brintalix. I can probably use for patients who don't respond to Remeron, or those who don't respond to Luvox, which means you all become third line, huh?
Yeah.
Which is still good, huh? It's not bad, okay? Because then you at least enter the government hospital. And then you can take it from there. Once you get in a tender, then your reps can start promoting, hey, dog, use, Brintalix more than Remeron, use more, That's how you can build your business. So that's what you need to find out.
What I understand is that government, they reserve Brintalix for patients who needs cognition, meaning to say like working adults or their own doctors, those like still need to function. So like, elderly or those not working, they will tend to give not Brintalix.
Okay.
Because it's quota.
Yeah, so what that means, Fiona, when it comes time for the new tender, somebody must be convinced in the government hospitals and MOH to ask for a tender just for the Brintalix specification, which includes cognition improvement. Somebody needs to put that out, because then you all have got your own category.
Okay.
Separate from Remeron and Luvox. Let them both fight there. So you all don't fight anybody. You all have your own market in public.
Okay.
Yeah. So that comment, by the way, also, Fiona, put that under your brand information that government doctors, MOH doctors use Brintalix because they reserve it for those who need cognition, improve cognition.
Brand, okay.
Yeah. So because that's your strength, by the way. I'm giving you a tip for the SWOT analysis.
Use for patients needing cognition.
Yeah, because that's a strength that you have, they all don't have.
Yeah.
So you are alone, alone in that category. You just created a category for yourself. Now the question is how to get that into the tender. That's the thing. How to get, the tender, whoever is in charge of tender, to ask for the tender for antidepressant with improved cognition. That's how the tender must come on, Then only you can play the game, nobody else.
Okay.
Okay. Things is becoming clearer now, Fiona? Huh? Okay. Yeah. Very good. Okay, so I think you just need to find the price and put it there. Okay, pretty good, Fiona. Let's move
on. Next will be SWOT.
Okay, all right, good. So that means we have finished with Brintalix. We have finished with Lexapro. Is there anything else? Yeah, I think that's good, Fiona. Yep, good, beautiful. Let's. The only thing, Fiona. Let me see. No, nothing else. I got nothing else to comment. I think we are good. good enough for next Friday's session.
Okay.
But that's not the end, Fiona. The only point I want to make to you is, as you go along, maybe next week some new information comes to you. Just come back here and put it wherever it is relevant. Yeah. So this is a living document. It is not a static document. It's dynamic. So you keep adding on whatever is relevant.
Okay.
And you take away whatever is not relevant also.
Yeah.
Yeah. Okay. Good.
Okay.
All right. So we want to go into EBITDA immediately, or you want to take a break, or?
I'm okay.
Okay.
To go immediately.
Let's go.
Let me see. EBITDA. Okay. Screen. Hello?
All right. So Fiona, the first comment I have for you is, whatever is common for Lexapro, Brintalix, that is common, economic situations, all just copy and paste here. Yeah, just copy paste here, put here.
Okay.
Save your time,
Okay.
Save your time, because it's the same thing, whatever you have for Lexapro and Brintalix, the economic situation will be exactly the same.
Okay.
Maybe at the most, you just have to change something that is relevant for Alzheimer's. That's it. Anything that you mentioned for depression, change it to Alzheimer's.
Alzheimer.
Yeah.
Right.
Okay. Good.
So next.
All right. Okay. Also, this is treated by geriatricians.
Yeah. Mostly geriatrician because it's quite not easy to treat.
But hang on, Fiona. You need to also find out. You need to confirm that. You need to confirm whether that is true, that all Alzheimer's is treated by geriatricians, or how many percent is treated by general physicians.
General physician. Okay. How many percent treated with general?
Yeah. And what about neurologists? Do the neurologists also treat?
I don't think so. But let me find out from my geriatrician.
Yeah.
Treat.
Do you know any general physicians and neurologists?
No. Geriatrician, yes, but not.
Any of the other two specialties buying EBITDA?
No, not neurologist. I don't think it's neurologist.
Neurologists don't buy? Okay. What about general physicians?
Also no, but
No.
let me check let me check again. General neurologist.
Interesting, huh?
Okay, yeah, interesting. Never thought
because I can't believe that 35 geriatricians in the whole country will be treating all the Alzheimer's patients. That's the only thing I'm trying to figure out, because I know before geriatricians came on board, all treatment of Alzheimer's was by general physicians.
Okay.
So, and 35 geriatricians is very, very small to handle all the Alzheimer's patients in the whole country, for sure. So somebody else must be diagnosing and treating them.
Yeah.
And this information also, Fiona, about the number of geriatricians, who treats Alzheimer's and all that, you can put that under customers / patients.
Oh, okay.
Yeah, because that's more relevant to put it over there.
So I move the whole thing to.
You can put it over there. Yeah, move it over there. Right. So increasing elderly population. Okay.
Patient.
How many percent of elderly people get Alzheimer's? Huh?
Wow.
Any idea? Does the Alzheimer's Foundation or Association have some data on this?
No, I have got no idea. Maybe I can ask. I will ask also my direction because I emailed him. I think he has no time to reply me yet.
Sure. Okay.
I'll ask my direction.
Yeah. Okay. All right. Yeah, I think we can move from here.
What was the question again?
What is the question? How many percent of elderly people
will get Alzheimer's?
Yeah. What's the incidence rate of Alzheimer's among the elderly?
All right. Then this will be the same as our depression, the example.
Yeah. So just check and see, Fiona, whether geriatricians on Doctor on Call, how many of them actually do online consultation?
Yeah.
Because it's a different group. Maybe they behave differently. Who knows?
Yeah. All right. Maybe. Yeah.
Yeah. Because if I'm not mistaken, I think this is what I think. I think Alzheimer's is a category, a disease or condition category where I can do teleconsultation. I can see you, and maybe from your body language, maybe from the way you reply, I can, detect whether you are improving or not improving and all that. Because I think Alzheimer's, you are basically trying to see their cognition, and I think you probably have some tools that you can use to, detect this via online consultation. I think, so you just need to verify this.
I think Doctor on Call only has one geriatrician.
Oh.
And also need to book appointment. Only appointment.
Okay, so looks like nobody is using, So yeah, so make the same comment just like for Brintalix like Lexapro.
I think it's tough for elderly.
I don't think it's the problem with the elderly. I think it's the Malaysian society which is not ready yet for teleconsultation. We are not ready. People in other countries are very ready, but not in Malaysia.
Not yet.
Yeah, we still feel that, if I'm a parent, if I'm a child and my father or mother have Alzheimer's, I still feel that if I don't see the doctor physically, that means my value of the consultation is lower.
Yeah.
So I would rather put my elderly parent in the car and drive, 1 hour of traffic and go to the clinic and wait for another hour to see the doctor. I'll feel happy.
Yeah.
So that's a Malaysian mentality, So we still haven't overcome that. Okay, so environmental, okay.
Should I put this in social rather than environmental?
You can put it under social. Yeah.
So I don't put it here.
Yeah, so your environmental is nothing also.
Yeah.
Okay.
Right. So then I will have to add the growth, 5 years growth chart here, right?
Which one?
You haven't see over here.
Yeah, okay. Yeah, so put your 5 years growth. So show me now, Fiona, what has the 5 years look like? Let's see. How old is Ebixa, by the way?
15.
Oh.
Very, very old.
It's an elderly. It's an elderly drug for elderly people. Okay.
It's actually not really growing.
2020 again, does it include PharmaServe data?
I'll have to double check. But I don't think Alzheimer's for Ibiza is growing. We are actually...
You only declined last year,
Yeah, last year. And also
otherwise, you probably would have grown. So if you look at your growth rate, Fiona. Of course, you're going to report that 2020 decline versus 2021.
Yeah.
But 2020 versus 2016, what is your growth?
Okay, 2018. Around 130%.
Wow. Growth rate of 130%. Wow. This is fantastic. And do you have government sales as well?
Yeah.
Oh, you got, okay. All right. Okay, so this looks good, Fiona.
Actually, I don't think it's 100%. If you see from here, it's around
30%, huh?
Yeah.
30%, okay.
Not so much.
But, but 30% is still good. It's double-digit growth, huh? What do you mean it's not much? It's very good, Fiona. 15 euro product growing at 30%. I tell you, a lot of people die for this, huh? Very good. Yeah. Wonderful. Okay. Let's move on to what is the next thing. Okay, so you were showing the 12 month. 12 months doing very well. What is your 6 month and 3 month?
6 months is like this.
Wow. Well, why did it take off in November onwards? Huh? Just wow. Or rather December onwards. December it just started flying. Huh? 6 months. Why? Fiona, any idea why?
December.
The December, May period and June period.
No.
Let's have a look at the 3 month.
I have no idea.
Okay. 3 month. Okay. You look at this, Fiona. The 3 month. The 3 month is much smoother than Brintalix, huh?
Yeah.
Oh, that's a bit weird also, you know. That's another reason why something is happening with Brintalix. Right? But Ebixa, okay. I don't see the big issue here. Because you're moving between a very narrow band, between 13,000, 130,000 to 200,000. That's okay, not too big a gap. And then it looks like your things are improving since February, April this year. Yeah. I don't think there's anything to comment about Ebixa. But Brintalix, definitely you got to find out what's going on.
I will check on Brintalix. I'll check the number again.
Yeah. No, but I don't think there's an issue with the number because when you look at the 6 month for Brintalix and the 12 months, it looks okay.
Okay.
No, it looks okay. So I don't think it's a data issue. It's something behind the data, something happening with the data. Why people are buying, so erratic. Yeah. Okay. So once again, Fiona, the chart, I leave it to you, Fiona, whether you want to put the 12, 6, and 3 months all on one slide or separate slide, doesn't matter.
Yeah.
But the comments all just put under the brand.
Yeah.
Just put it over there. Okay, good.
Yes, okay. So then the number of purchaser.
All right. So before we look at this, how many customers do you have, Fiona?
I have around, let me see. Not many for
Is it about 300?
350.
350, yeah. Okay, yeah, not many, yeah.
Not many.
And the bulk of it in Central, okay.
Central and then Northern, Southern.
Okay.
And then the sales, Yeah. The sales
Overall,
is
okay, this quantity, yeah.
quantity boxes sold. Central has the biggest chunk. Mm.
Okay. Yeah.
Mm.
Okay. Fine.
Yeah.
Next one.
And then it will be patient flow, right? No.
What about channel by channel? Sales by channel?
Sales by channel. Oh, the one that I did for
So that means by private hospital, government hospital, pharmacies, and what clinics?
yeah, I don't have it for Ibiza. I think I didn't add it in for Ibiza.
Okay.
Sales channel.
So just add that in, huh?
Hmm.
Do you remember? Do you have it anywhere? Fiona, this data?
Mm. Sales by channel, no.
You
In
don't have, huh?
IMS, yeah,
Yeah.
IMS.
Yeah. So I think you got to extract from
Yeah,
IMS.
I will extract it.
Look at the, I would say, just like the other two. I think you did the MAT, right? Was it MAT you did? Or was it Q1?
Q1.
Q1. Okay. So go through the Q1. We just need to know where the bulk of your sales coming from. Is it private or is it government? And then is it pharmacies or is it clinics? And then if it is clinics, once again, you just need to make sure that we just need to make sure whether GPs will diagnose. Do they diagnose Alzheimer's? Do they have the tools to diagnose Alzheimer's? And then do they initiate therapy?
Okay.
Yeah. So all that we need to put under the customer patient information. All right. Okay.
Then it will be
Yeah. So look at this. So 35 geriatricians are looking after 50,000 Malaysians with Alzheimer's. How do they, well, if that is really the case, Fiona, they will all the geriatricians will be multi millionaires. From sunrise to sunset, they are looking after AD patients. Oh, that's good money there, you know. Really, really good money. Okay. So you just need to find out how is this being. Oh, by the way, how do you decide 43% for government, hospital 15 for private, and the rest? I mean, pharmacies 37. How did you get that
on the
data?
IMS?
So you have the IMS data.
I open the IMS, so I just calculate based on that. It's just that I didn't do the one that I did for example, and Bentelix.
Okay, so that means according to this report, your channel, the bulk of your Ebixa mostly bought by government. No. Sorry. No. 43 versus 57. Correct? 57% of Ebixa is from the private sector.
Yeah.
Almost equal, government and private? Okay.
Government, actually we lost tender like a few. For now we only have a few hospital buying original Ibiza.
And that's still quite a lot, That's almost half your sales, coming from those guys. So very important sector to look after. So why do they use Ebixa instead of a generic?
They are only using the 20 mg because generic still but are very new. 20 mg still very new. So yeah, that's why they're buying. But if generic comes in and they secure themselves, I think by next year we will lose everything.
Okay, so good. So make sure you whatever you just told me, Fiona, you put it under your customer patient slide, that information. Yeah. So there is a high danger that I know. First of all, you're going to say that government is buying Ebixa solely because of the 20 mg, which generics don't have. High danger that, when generics have the 20 mg, we are going to lose this segment, which means your sales is going to be half, either next year or the year after, or one of these years is just going to collapse,
But then the government hospital, right, includes MOE.
Okay. So what do the MOE do? Do they use Ebixa?
MOE.
And how many percent of your government sales comes from MOE?
Hold on.
Okay.
Yeah, let me check using IMS.
Okay.
My IMS data. Yeah. With sub-channel. They didn't. I need to do I need to include the breakup of government that in IMS.
Yeah. So find the data, Fiona, and just put it under the sales slide.
Okay. How many? Okay.
Yeah. So then you know exactly how much you probably will lose once the generic with 20 mg comes in. And then, of course, the other issue also, it doesn't mean that if MOE is using Ebixa 20 mg, they may also switch to the generic 20 mg.
Yeah,
Will they switch? Yeah, will they switch?
So recently I asked one of the doctor. We have 10 and 20 mg lah. So this doctor is UMMC geriatrician. So I kind of asked him, how would you decide generic or original? So usually he will try to convince patient to use original.
Yeah.
But then when the patient comes in and tell you like, per month I have to spend 600-700.
Yeah.
It's very tight. So then he will change to generic.
Okay. Now the other thing also, Fiona, although 15% of your sales comes from private hospitals, what will the private hospitals do once the generic 20 mg is available? Will they also switch?
Not sure.
Okay. Yeah.
I would think it depends on whether patient, this is my theory lah. I would think that, it depends on whether patient will tell the doctor like, it's a bit expensive, do you have a generic? But usually if I go and see a doctor in a private hospital, definitely they will give me like a original first. Unless I say it's so expensive, then they will change it to generic.
But that is dependent based on the hospital, Fiona, whether the formulary board decides to go for generic or not.
Okay.
Because once they decide, the doctor has got no more say. Because a lot of private hospitals are also switching to generics now.
Yeah.
So if the formulary board say, okay, time for us to you start using generics, then the doctor has no say unless the doctor has got the authority or the right to dispense his own medication. But if it is coming from the hospital pharmacy, the hospital will decide,
Okay.
And very often the pharmacists are very strong in these private hospitals when it comes to making that decision. So we just need to verify all that info. But talking about this, Fiona, question is, why haven't private hospitals started using generics Lexapro? Why are they still using the original Lexapro?
You mean why are they still using original Ebixa?
No, Lexapro. I'm talking about Lexapro because you got quite substantial Lexapro sales in private hospital, right? From what you showed just now. Is it quite big?
Clinic. it's bigger than. I don't think it's big. Wait, private hospital, no.
For Lexapro, how many percent is coming from there?
15.
15 also. Okay.
Yeah.
Lexapro is 15% from private hospitals. Which is the biggest one?
If it's based on total biggest, you mean compared to GP clinic?
Yeah, the biggest
clinic is
channel.
around 31 clinic.
Oh, clinic is 31.
Yeah.
So clinic is 31. So doctor decides that he wants to use the original. Private hospital 15. And then where is the remaining sales coming from?
It will be from pharmacy. I think pharmacies one.
13. Pharmacy 13 and private hospitals 15.
Yeah. But the pharmacy should be like, prescribed, because pharmacies, they don't diagnose, right? So it could be from MOE, it could be from private.
Yeah.
It could be from clinics as well.
Yeah. And then 40% okay, that's patient flow. Okay. All right.
Patient
flow. Okay, fine. Yeah. So that's everybody, not just you. Okay. But if it is just you, if we are looking
just me,
at
Lexapro, IMS, then it will be like this.
Oh, clinic, but you see, yeah, so your hospital here is how many? Private hospital, how many percent is it? 24.
24.
Is it 24? 24%. 24. That's quite big also, 24%. 1 quarter, So why these hospitals haven't switched to generic? I can tell you this, Fiona. When it comes to hypertension, many government hospitals, many private hospitals have stopped using Novas, the original. They are using amlodipine.
Oh, okay.
So that's why I'm quite curious to find out why for Lexapro still a huge number of private hospitals are still using the original. If you can check with any one of your doctors, your specialists, just check with them, why aren't they using, or rather you should ask them, why are they using original Lexapro?
Okay. I wanted to ask, right, for IJN, is it under private or?
Yeah, IJN is considered private.
Okay.
It's not public, yeah.
Okay. Because IJN contributed, I think they have been buying original. Only recently, like I think 2 months ago, they switched to generic.
Okay. Okay. All right.
So,
yeah, so you just need to find that out, Fiona. Okay. Why are they still using Lexapro? Because the same thing applies to Ebixa also, Why are these guys
using original?
Yeah. Okay, very good.
As for the GP, I need to find out, like,
yeah,
is it just follow up or they initiate?
Sure. Yeah. Okay. Yeah, so all this just like we did for Lexapro and Brintellix. So this is customer slash patients.
Yeah.
Okay. All right. Next one.
Yeah, hold on. Okay. So this is
okay. So this is yours only, right? Oh, so the same 9 reps are handling Ebixa also,
Yeah. It's like a reminder.
It's a reminder, Okay.
Yeah.
Okay. Well, $508. Is it for 1 month therapy?
1 month only.
For how long?
1 month.
1 month, $508. Oh, okay.
So that's why we doctors, some patient complain.
Okay. So, Fiona, when you put the SKU 2, what does that mean 2?
Is it how many like one box I have 28 tablets, another box I have 56 tablets? Is that?
Okay. So what you should do, do it for also Lexa Pro and Bentelix also. Under the SKU, put the actual pack sizes. So you can put there 28s and then 50 what 6.
56 actual pack size.
Yeah. So put the SKU as 28s and 56.
Okay.
Is it blister pack or is it aluminium? What type of packaging?
I've never seen.
Oh, you haven't seen? Okay, you should see,
Okay.
As a brand manager, you must know what your brand looks like. So just put that information in also.
Okay.
The blister or whatever. So strength, okay. Are both the strengths 28 and 56?
Sorry? Oh, no. For 10 mg is 56, for 20 mg is 28.
Okay. So just clarify that somewhere there.
Okay.
Yeah. All right. What you can also do, Fiona, is instead of having one line SKU, the other one strength, you can just put everything in one row. You can say strength / SKU, and then you can put 10 mg in one line. You can put 56, and then the next line 20 mg 28. That's it.
Oh, okay.
So save your space line, no?
Okay.
Right. So normally is the strength first, Fiona, before the SKU. So strength / SKU. So
okay. Okay.
all right, good. So brand category done. Okay. Is your next one the competition slide?
Yep.
Only 2 competitors,
Because I think IMS, a lot of generic, they are not inside. So I don't really have like the full picture of.
So according to IMS, this is Exelon is number 1 in public market,
Exelon.
Not the generic, the public market.
That's why generics are all not in the IMS. So I only have like 4 of if you can see from here, only have like these few types of medication in IMS,
Oh, okay.
So we don't have the full picture.
So are you saying that there is a possibility that in the government sector, number 1 is a generic and not Exelon?
Yeah, possible.
Oh, okay. All right. Okay, good.
But then I think so far, Exelon is still the original in MOH. They are still using the original.
So they're not using the generics, in the government?
No.
Not yet. So and Exelon is what, 10 milligram or?
Exelon, the one that they are using, is it?
Yeah. Oh, it's a patch, Or they got both
patch
and capsule.
But I have to find out like they are using which one.
Yeah.
If not mistaken, it's patch. If not mistaken.
They're using more of the patch, is it? Okay. Okay, so it's a different formula presentation. Okay. And then Aricep is they have tablets and dispersible.
Dispersible, yeah.
Okay. Compliance, okay. All right. Yeah, so I think what you should do, Fiona, although you're presenting this competition table, in the slide on your commentary, just state there we really don't know how many generics are in Malaysia and how much their sales are, because it's not captured by IMS.
Okay.
So just put that statement there so that everybody is very clear that there are generics, but we don't know how big they are.
Not captured. Okay. This is for the brand comment, right?
Yeah. No, this is under competition.
Competition. Okay.
Yeah. So your next slide under competition, you just put those comments there.
I don't have a next slide for competition.
Or then just create another one just to put all these comments. Rather than putting your comments underneath this table, because then it, too many words and all that. Just create another slide.
Okay.
So in that slide also, let me see. That slide, you should. Do you know if there is any generic of Ebixa 20 milligram that is being registered now?
I think it's under Torrent, but I can find out the name of the drug.
Do you know anyone in that company that you can ask?
Torrent? No,
no. Okay.
I don't know anyone.
Yeah. So do you know of any doctor who is using Torrent?
I think all of the doctors would know.
Okay. So then what you should do this. Just call a few of them and ask, doctor, do you know if this company is registering the 20 mg?
Okay. Registering 20 mg.
Then at least you know what's going to happen. When did they submit for registration and stuff like that?
Okay. 20 mg. All right. Ebixa 20 mg.
Because if I was that company, Fiona, if government is using my generic Ebixa, then I will definitely make sure I register the 20 milligrams so that I remove you completely from the government.
Yep.
I will do that, So good to find out, what's going to happen to Ebixa in the government.
Okay.
Yeah. Yeah.
I think I heard rumors that Torrent they are actually going into the government to talk about the 20 mg, but I'm not sure whether it's registered or what.
Yeah. So just ask around a few doctors, the government doctors, the private doctors, and see what they say. Okay. All right.
Yeah.
So is that it? Is that the only
last
slide? Okay. Wonderful.
Yep.
Okay. Good. So how do you find the session, Fiona?
I think Ebixa is like the least product that I know.
Your least priority, yeah.
Yeah.
Okay.
All right. That's why I don't know a lot of things like, I never thought of this, I never thought of that.
Yeah. So there are some gaps that you just need to fill up. In order for us to, if we can get it before we do our SWOT analysis, very good. Because then it will help you a lot. If it is critically important, then I would really encourage you over the next 7 days or 6 days, try to get whatever you can. Contact whoever you need to, whether rep or sales manager or customer. Just make an inquiry. Yeah. And then we can take it from there. So it looks like from my side, you don't have much gaps to fill up. You got a little bit of gaps. So I believe that you by next Thursday, you should be able to get the bulk of it. Yeah. So then we shall be ready for next Friday's session.
Okay.
All right.
So next Friday, have to present the whole thing again?
No, next Friday, you guys don't have to present. Next Friday, my turn to present.
Oh, swap.
So y'all just listen, and then you will have the next assignment.
Okay.
That's it. Yeah. All right, Fiona?
All right, Ken.
Okay. Thank you so much, Fiona.
Thank you.
What I will do, I will, once this recording is complete, I'll put it up on our LMS, and then you can just go there and review it if you wish. Okay. All right. Okay. Wonderful. Thanks. You have a good day, Fiona. Good weekend. See you next Friday.
See you. Bye-bye. Thanks a lot.
You're welcome.